The trauma bay doors blew open at 11:47 p.m., and the stretcher came in hard and fast with blood soaking through every layer of field dressing they'd wrapped around him. He was a Navy SEAL commander, built like something carved out of granite, and he was dying. The monitors were already screaming. The trauma team was already moving. And Dr. Roland Vance, the most celebrated surgeon in the state of Colorado, the man with his own television documentary deal, was already stepping forward to take charge in front of the cameras. Nobody looked at the nurse in the corner. Nobody ever looked at her. But she was looking at the patient, and what she saw on his neck, the way his trachea had shifted, the way his veins were standing up like cables under the skin, drained every drop of color from her face. Because she had seen that exact injury before, not in a hospital. In a burning valley in Afghanistan, with enemy fire coming from 3 directions, and a man bleeding out beneath her hands. Before we go any further, if you've never been to this channel before, hit that subscribe button right now, because the story you're about to watch is the kind they don't make anymore. Every week we bring you cinematic drama that hits different real tension, real stakes, real moments, where the people everyone ignored turn out to be the ones who change everything. Hit like, drop a comment telling me what city and country you're watching from. I want to see how far this story travels. Now let's go. The first thing Nora Welles ever did wrong at Hargrove Peak Medical Center was show up. That was how it felt. Anyway, she'd driven 11 hours from a rural critical access hospital in western Wyoming. Everything she owned loaded into a 10-year-old pickup truck with a cracked dashboard and a heater that only worked on one side. And when she walked through the employee entrance at 6:50 in the morning with a travel mug and a duffel bag over one shoulder, the charge nurse at the trauma desk had looked at her the way a person looks at a stray dog that's wandered into a restaurant kitchen. Not angry exactly, just deeply inconvenienced. "Transfer from Colby Junction?" the charge nurse said. That's right. The charge nurse, her badge read Patricia Lund, Run, Charge, with a cluster of little certification pins below her name, that she clearly wanted people to notice Nora's paperwork at arm's length and studied it the way a customs officer studies a passport from a country they've never heard of. "Colby Junction," she said again, slower this time, like she was testing the weight of it. "That's a 20-bed facility. 18, actually. We downsized." Patricia handed the paperwork back without smiling. Dr. Vance runs a very specific kind of trauma program here. He has standards, and he has expectations, and he makes both of them very clear. "I'll meet them," Nora said. Patricia's smile was thin enough to cut glass. Everyone says that on day one. Hargrove Peak Medical Center occupied the northern edge of Crestfall, Colorado, a mid-sized city with an overpriced skyline, and the particular self-importance of a place that had decided it was significant and had been telling itself so long enough that it had mostly started to believe it. The hospital had been built for volume and for reputation, and it delivered on both counts. 16 trauma bays, a rooftop helipad, a research wing that published papers at a pace that kept the grant money flowing, a trauma surgery department that was, depending on who you asked, either the finest in the Mountain West or simply the most in the mountain or simply the most aggressively marketed. Dr. Roland Vance had made absolutely sure of the latter. He was 53 years old with the kind of face that read as authority from across a crowded room, square jaw, silver-streaked hair, worn just long enough to look distinguished rather than unkempt, hands that moved through a trauma bay with a practiced theatricality that he had refined over 3 decades until it looked effortless. He had trained at Johns Hopkins, done fellowships at 2 centers in Europe, built his reputation through a combination of genuine surgical skill. And he was skilled, that part was real, and a relentless self-promotion that had eventually attracted a production company which had been following his department for the past 3 months, filming a documentary series titled The Trauma Floor. Roland Vance had taken to the cameras the way a man takes to something he had always secretly believed he deserved. He wasn't a bad surgeon. That was the thing about him that made everything else more dangerous. He was good enough that he'd never truly been forced to question himself, and he was arrogant enough that he'd stopped doing it on his own a long time ago. The result was a man who moved through his hospital like a system with no error checking, fast, confident, and completely convinced that the output was always correct. Nora Welles was none of those things. She was 44 years old, medium height, with dark hair she kept pinned back and brown eyes that had a habit of going very still when she was concentrating on something. She had a quiet way of moving through a room, not timid, just economical. The particular efficiency of someone who had spent years operating in environments where unnecessary motion meant wasted energy, and wasted energy could mean a decision made too late. Her face had the kind of weathered quality that came from extended time outdoors, in conditions that were not kind, and her left hand had a slight tremor when she was tired or when she'd been pushing too hard, nerve and old injury she'd never fully explained to anyone at this hospital and didn't intend to. Her resume listed 6 years in the Air Force, which she described as medical support, followed by 14 years of civilian trauma nursing, most recently at Colby Junction Regional. On paper, she was unremarkable, an experienced rural nurse taking a step up to a larger facility. The kind of hire a department head makes to fill a gap on the schedule and doesn't think about again. That was exactly how she'd written it. On her second day, she made the mistake of speaking up during rounds. The patient was a 41-year-old male, admitted the previous evening with blunt abdominal trauma from a head-on motor vehicle collision. 2 hours post-admission, he'd been resuscitated aggressively and his initial vitals had stabilized, and Dr. Vance had made his plan of care clear during the overnight notes. When Nora took over his bay at 6 a.m., she did her assessment the way she always did: hands first, monitors second, paperwork last. By the time rounds started at 8:30, she'd noticed 3 things that weren't in the overnight notes. His urine output had been trending down for 90 minutes, settling at 18 milliliters over the last hour, which was less than half of what it should be. His blood pressure, while technically within acceptable parameters, had been drifting downward in a slow, consistent slide that wasn't matching the fluid volumes he'd received. And when she pressed his abdomen gently, at the lateral margins first, and then more centrally, it felt different than the admission note described. Firmer, the kind of firmness that doesn't announce itself on a monitor but tells you something through your fingertips if you felt it enough times. She had felt it enough times. When Dr. Vance reached the bedside, with his residents and his documentary camera crew positioned at the room's edge, Nora waited for a natural pause in his presentation before she spoke. Dr. Vance, his abdomen has changed since this morning. Rigidity's increased from admission baseline, urine output is down to 18 mils the last hour, and his pressure has been drifting lower over the past 90 minutes, even with the resuscitation volumes he's received. I'm concerned about his pressure is stable, Vance said, without looking up from the chart. It's trending. The drift pattern over the last... He looked at her then not with hostility, which would have been something, but with the particular patience of a man who had already decided how this conversation was going to end. And you are? Nora Welles. I'm the assigned nurse for this bay. Right. His gaze moved briefly to the camera at the room's edge, then back to his residence. And on what happened next was something Nora had seen in various forms, in various settings. The decision to use someone as a teaching prop. Let me give you all a point about the difference between nursing observation and clinical interpretation. She stood completely still. She had a great deal of practice at that. Nursing observation is valuable, Vance said, in the measured tone of a man who had given this speech before, and enjoyed it a little more each time. Genuinely valuable. I mean that. But observation without clinical context is just elevated anxiety wearing a stethoscope. One of the residents laughed, the one who always laughed at the right moment. Nora had already noticed which one it was. Mr. Calloway is post-blunt trauma. He's been resuscitated per protocol, and his vitals are within acceptable parameters. What you're describing falls within expected post-traumatic variation. The abdominal rigidity is a post-traumatic finding. He said it with a finality that was designed to be the last word, and in most rooms, it would have been. Stay in your lane, Ms. Welles. That discipline is what makes a trauma floor function. He moved to the next bay. The camera followed him. Nora stood at the bedside for a moment longer and looked at her. Patient looked at his face, which had a gray quality she didn't like, a flatness around the eyes and mouth that wasn't on any monitor anywhere. She noted the time. She documented everything she'd observed with precise and specific language, the exact urine output numbers, the exact blood pressure trend with timestamps, her physical assessment findings described in objective clinical terms, and a notation that she had communicated her concerns to the attending physician at 8:43, and his response had been to continue the current plan of care. She did all of it quietly and completely, and with the particular care of someone who understood that documentation was sometimes the only weapon a person had left. 41 minutes later, Calloway's blood pressure dropped to 80 systolic and didn't come back up. The emergency surgery team found 2 liters of blood in his abdomen. He survived, barely and not for any reason connected to the speed of anyone's recognition that something had been wrong for hours. Dr. Vance did not acknowledge the incident. His documentation noted that the patient had experienced a delayed hemorrhagic complication, the word delayed doing a considerable amount of heavy lifting in that sentence. There was no conversation, no acknowledgement, no moment in the hallway where he found her and said anything at all. He simply moved on, because men who have never developed the habit of being wrong don't generally develop the ability to admit it either. The documentary camera crew had been in the hallway when the crash happened. They had footage of the rounds, of Vance dismissing her, of the alarms going off 41 minutes later. Nora suspected nobody had thought carefully enough about what that footage contained. She filed the thought away and said nothing. By the end of the first week, she had mapped the floor completely. Not just its physical geography, where things were, how the supply rooms were organized, which equipment was reliable, and which had a habit of misbehaving, but its social architecture. How the census moved through the week, which residents were solid under real pressure, and which ones went stiff and formal when things got fast. Which attending behaviors were consistent, and which ones changed when cameras were in the room. Which patients were going to be difficult, not because they were demanding, but because they were frightened, and what frightened people needed that was different from what demanding people needed. And she'd mapped what she thought of as the fault lines, the places where the floor's confidence in itself exceeded its actual capability. Every institution had them. Most institutions didn't know where they were. There was one exception on the resident staff, Dr. Sasha Holt was a third-year surgical resident, 28 years old, with quick dark eyes, quick dark summon, and the permanently slightly frantic energy of someone who was 3 years into a program that had taken everything she'd given it and kept asking for more. She was genuinely sharp, the kind of sharp that couldn't be faked, because it showed in how she listened, not just in how she talked. She was at the particular stage of training where she was starting to understand that the certainty the attendings projected and the accuracy of their decisions were not always the same thing. And that realization was sitting in her like something that hadn't fully resolved yet. She'd watched the Calloway incident, all of it. On the 4th day, she found Nora in the medication room, checked that no one else was nearby, and asked quietly, "How did you know?" Before the crash. "What tipped you?" Nora considered the question seriously, which was the only way she knew how to consider things. His belly told me. Vance said the rigidity was expected post-trauma. Vance wasn't at the bedside at 6 a.m., and again at 8:30, Nora capped the syringe she'd been drawing. that kind of changed the progression of it. You can't read it off a single assessment. You have to know what it felt like 3 hours before. By the time the numbers catch up to what the abdomen is doing, you're already behind the bleed. Sasha was quiet for a moment, working through it. Where'd you learn to assess like that? Rural trauma, Nora said, which was true. It just wasn't complete. Sasha had the expression of someone who knew they weren't getting the full answer and was deciding whether to push on it. She was smart enough to read the room. He's not going to acknowledge it, she said. What you called on Calloway. I know. That doesn't bother you? Nora thought about it with genuine consideration. It bothered me for a long time, she said finally. Now it mostly just tells me what I need to know about how a room operates. That's useful information. Sasha looked at her for a moment longer than the conversation strictly required, and then nodded slowly, like she was filing something away. She left without pressing further. Nora appreciated that. Most people didn't know when to stop asking. The second week brought the cameras deeper into the unit's daily life. The production crew had settled into a semi-permanent presence on the floor 2 camera operators. A sound technician, Jeff, who had the particular name gift of making himself functionally invisible in clinical spaces. He moved slowly, spoke quietly, and had learned within the first 2 weeks which staff members would perform for the camera and which ones wouldn't. And he filmed both categories with equal patience because he understood something about documentary work that a lot of people in his field had forgotten. The real material usually came from the people who weren't trying to give it to you. He'd been watching Nora Welles with the particular interest of someone who'd found something he wasn't expecting. Dr. Vance, by contrast, had evolved at what Nora thought of as an ambient performance mode, a slight elevation in his vocal register, a tendency toward more deliberate and quotable phrasing, a habit of framing clinical decisions as teaching moments, even when no teaching was technically occurring. The residents had adjusted to it. The floor staff had adjusted to it. It had become the atmosphere of the department, invisible, the way atmosphere always becomes invisible when you breathe it long enough. On Wednesday of the second week, Nora was assigned to a 47-year-old woman named Darla motor vehicle versus pedestrian, right-sided rib fractures, pulmonary contusion, anxious, in the particular way of someone whose body had become frightening to them. Every time Darla tried to sit forward to ease the pressure in her chest, her oxygen saturation dropped. Every time it dropped, her anxiety spiked. Every time her anxiety spiked, she breathed harder, which hurt more, which made her sit forward again. The loop was tight and it was getting tighter. You need to stay back, Nora told her, pulling the chair close to the bedside so she wasn't standing over her. I know lying back feels wrong right now. Your body is telling you something's not working, and it's right, but sitting forward isn't fixing it. It's making it worse. I can't breathe, Darla said. Her eyes were wide and glassy with something close to panic. I feel like I'm suffocating. I know. Here's what's actually happening. Nora kept her voice level and specific because vague reassurance didn't work on people who were scared enough to be paying close attention. Your ribs are cracked. Breathing hurts, so your body is automatically doing less of it to protect you. But that means your oxygen drops, which makes you feel short of breath, which makes you want to breathe harder, which makes the ribs hurt, which makes your body want to protect them again. It's a loop. Darla stared at her. How do I stop it? We're going to work on it together. I'm going to adjust your pain management, and I'm going to reposition the bed to a specific angle, not flat, but not sitting up all the way either. And I'm going to sit here with you while your body figures out that it can breathe without it hurting as much. It's going to take about 10 minutes. That's 10 minutes. You just need to let me do the thinking for you for a little while. She spent the next 12 minutes at the bedside, not hovering, not running through a checklist, just present in the way that mattered, adjusting small things, watching the monitor, talking when talking helped, and staying quiet when quiet helped more. The saturation climbed from 89 to 94. Not perfect. acceptable, and moving in the right direction, which at this stage was what the situation required. The camera was at the hallway's edge. Nora was aware of it the way she was aware of most peripheral things, registered, categorized, and assigned the level of attention it deserved, which was less than what it was getting from almost everyone else on the floor. Later that evening, the producer, Jeff, stopped her near the nurse's station. "What you did in there," he said, "the way you talked her through it. I've been filming in medical settings for 6 years, and I don't see that very often." "Patricia's better with the family communications," Nora says. "She's been on this floor longer. I'm not talking about family communication. I'm talking about what you actually did clinically. Would you be open to a sit-down? Background on the nursing side of trauma, care what it looks like from where you're standing." "I appreciate it," Nora said, "but I'm not the story." Jeff looked at her with the expression of someone who was starting to think she might be wrong about that. But he was too experienced to push when a subject had made up their mind. He handed her a card. She thanked him and put it in her pocket and didn't look at it again. She understood something about cameras and documentation that Jeff understood from a production perspective, but maybe hadn't fully thought through from her angle what got recorded eventually, got reviewed. And the question wasn't whether she'd eventually want that footage to exist. The question was whether she'd end up needing it. Thursday night, she was 40 minutes from the end of her shift when the overhead speakers opened. Trauma activation. Level 1. Inbound military transport. ETA 9 minutes. All available trauma staff to Bay 1. The floor shifted into a different gear, not panic, because Hargrove Peak staff were too experienced for panic, but the particular sharp-edged focus of people who understood that Level 1 meant someone was very close to not being alive anymore. Nora stripped her gloves, dropped them, grabbed fresh ones from her pocket as she walked. She ran the radio briefing in her head as it came through the overhead relay. Adult male, early 40s, Navy Special Operations personnel, blast exposure during a classified training operation in a remote area. Bilateral tympanic membrane rupture. Significant right-sided chest trauma. Blood pressure hypotensive and unresponsive to 2 liters of crystalloid administered en route. Oxygen saturation measuring in the low 80s. The last number stopped something in her mid-stride. Low 80s. Right-sided chest trauma. Hypotension not responding to fluids. The combination assembled itself with a speed that bypassed language entirely, dropping straight into the part of her that made decisions. That is not a pneumothorax. She kept walking. She kept her face where it needed to be. But inside the quiet she always maintained in front of other people, something had gone cold and precise. Dr. Vance was already in Bay 1 when she arrived, taking his position at the head of the bed with the practiced ease of someone who knew where the cameras were. He was running through his pre-arrival checklist, allowed intubation tray, blood products, the sequence of interventions he was planning, the kind intervention in the kind of narrated internal monologue that only develops when a person has spent months performing their own thinking for an audience. His residents were positioned where he'd placed them. The room was running the way his room always ran. Nora took her position on the right side's second back, checked the crash cart out of habit, noted what was on each shelf. Her eyes stopped on the second shelf for exactly 1 second, and then moved on. The bay doors blew open at 11:47. The stretcher came through fast, flight medics on both sides. A relay of information already starting before the wheels fully stopped. Blood pressure, 68/40. Saturation down to 78. Right chest entry wound from shrapnel, partially treated in the field. The patient was unconscious or close to it, moving slightly, the particular restless movement of a body that was fighting something it couldn't quite reach. Nora looked at his face, and her mind went blank for half a second. Not because she didn't recognize him, because she did. The years had changed him. He was heavier through the shoulders, and the lines in his face had deepened, and There was a beard now where there hadn't been one before, but the jaw was the same, and the scar on the left side of it was absolutely the same, a pale diagonal line about 2 inches long that she knew the exact origin of because she had been the one who held pressure on it while they waited for extraction in the cold. Commander Garrett Tull. She had last seen him being loaded onto a medevac in the Paktika province of Afghanistan on November night 12 years ago, barely conscious, with her jacket pressed against his thigh where the femoral damage was worst. And she had talked to him the entire time steady, even relentless, because she understood that a person's voice was sometimes the only anchor left when everything else was coming apart. She had never seen him after that. Seen Ant? She had gone directly into surgery when the extraction arrived, and her next coherent memory was a hospital bed in Germany 3 days later. But she was not thinking about that right now. Right now, she was looking at his neck. His trachea had deviated, left not dramatically, not the kind of deviation a textbook diagram shows, but enough if you knew what to look for, if you'd seen it before, in conditions where there was no textbook and no time. His neck veins were distended, standing under the skin with the specific prominence of elevated pressure that had nowhere to go. And the flight medic's report of near-absent breath sounds on the right side completed a picture that was absolutely, unambiguously clear. Tension pneumothorax. Air had entered the right pleural space through the shrapnel wound, through a torn lung surface, through some combination of both, and it was trapped there, building with every breath, compressing the lung, pushing the mediastinum left, squeezing the great vessels, and grinding the blood pressure down and down and down. The body had been compensating for as long as it could. It had stopped compensating. He had maybe 60 seconds of viable cardiac output left. Maybe less. "Get the intubation tray," Vance said, his voice steady and decisive, exactly the voice of a surgeon who knows what he's doing. Dr. Vance. Nora moved toward him. She hadn't planned it. Her body committed before her thinking finished the sentence. "Don't intubate him." Vance didn't look up from his setup. "Ms. Welles, look at his trachea. It's deviated left. His neck veins are distended, and his right-sided breath sounds are absent. If you intubate him and start positive pressure ventilation, you are going to force more air into the right pleural space. The mediastinal shift will..." "I am aware of the physiology of intubation," Vance said. His voice had dropped into a register. She hadn't heard from him before, not loud, but with a particular weight to it, the weight of a man deciding something. "Then you know that positive pressure in a tension, pneumo, will kill him in under a minute. He doesn't need a tube. He needs a needle. Right now, before his pressure bottoms out completely." "You are a transfer nurse from an 18-bed rural hospital," Vance said, and now the residents had gone very still, and the camera was still rolling, and the room had a quality of held breath. "And I have been practicing trauma surgery for 30 years. So I am going to ask you one more time to step back, and I am going to do my job." And the monitor screamed. Saturation, 74%. Blood pressure, 58/32. It was a number that meant the conversation was over. It was a number that meant there were 10 seconds to make the right decision, maybe 15. And after that, the decision wouldn't matter because the outcome would already be written. Vance's hands moved toward the laryngoscope. "Get her out," he said. 2 staff members moved toward Nora, not aggressively, just with the compliance of people following an order from the person who gave orders in this room, which had always been Vance, and everyone in the bay knew it. Nora looked at the monitor. 71%. She looked at Garrett Tull's face. Gray. Still. His chest was moving in the small, desperate way of a body that had run out of room to breathe. She looked at the crash cart. Second shelf. The 14-gauge decompression needle was exactly where it always was. Her left hand was not shaking. She had been quiet for 12 years. She had stayed in her lane for 12 years. She had walked away from rooms where she was dismissed, had documented her objections, and let institutions do what institutions do. had rebuilt herself into something smaller and less visible, because smaller and less visible was what the world after her injury had seemed to require. She reached for the needle. She took the needle off the shelf with her right hand and turned toward the patient in the same motion, and the two staff members who'd been moving toward her stopped because something in the way she moved made stopping feel like the correct response. It wasn't aggression. It wasn't desperation. It was the particular quality of motion that belongs to people who have made decisions like this before and survived the consequences, and it reads differently in a room than anything else, quieter than authority, heavier than confidence, the kind of thing that makes bystanders pause without being able to explain why. "Move," she said, to the resident standing on the right side of the bed. Not loud, not a request. He moved. Vance's voice came from behind her, sharp and tight, in a way she hadn't heard from him before. "Do not touch that patient. I am warning you. Ms. Wells, if you touch that patient without authorization, I will have you removed from this hospital tonight, and your license." "Then call security," Nora said, and her voice was completely level, and she was already locating the landmark with 2 fingers second intercostal space, mid-clavicular line, the geography of it as familiar to her as her own name. "They can watch." She'd done this in a ditch in Kunar province with a headlamp and improvised materials. She'd done it in a moving vehicle with one hand braced against the ceiling. She'd done it twice in the dark with incoming fire close enough that the pressure wave moved her hair. This was a well-lit trauma bay with a properly manufactured needle and a man she had once refused to let die. She found the landmark. She angled the needle correctly, perpendicular to the chest wall, just superior to the 3rd rib, to clear the neurovascular bundle, the technique so deeply embedded in her muscle memory that her hands did it while the rest of her was still watching the monitor. She pushed. The needle entered. For 1 full second, nothing happened, and the room was so quiet that she could hear the ventilator cycling in the adjacent bay and someone's shoe squeaking on the floor somewhere down the hallway. Then the air came out. Not a trickle. A rush, a violent, pressurized hiss that was loud enough to make 2 of the residents flinch back from the bedside, the sound of a system that had been building catastrophic pressure suddenly finding an exit. The kind of sound that, once you'd heard it in the field, you never confused with anything else. The monitor. Saturation, 71%. Holding, 73%. Blood pressure, 60/34. 64/38. The trachea, she could see it from where she was standing, began its slow, reluctant drift back toward center. What one of the residents started and then stopped because the numbers answered the question before he could finish asking it. 76%, 81%. Vance had gone very still behind her. She could feel it without looking at him, the specific stillness of a man whose certainty had just encountered something it couldn't explain away. 86%, 91%. The blood pressure was climbing. Not fast, not dramatically. The body doesn't throw a party when it starts getting what it needs. It just quietly begins the work of not dying. 68/44. 72/48. The small, grinding recalibration of a cardiovascular system that had been minutes from irreversible failure and was now tentatively reconsidering. 94%. Garrett Tull's chest was rising properly for the first time since he'd come through the doors. The room was completely silent. Nora held the needle in position, maintaining the decompression, watching the monitor with the particular patience of someone who understood that a number going in the right direction was not the same thing as being safe. She was tracking his pressure trend, his saturation stability, the quality of his chest rise on both sides, the color returning to his lips, small specific clinical data points that assembled themselves into a picture her brain was updating every few seconds. Then she heard it, quiet, hoarse, like a man surfacing from a very long way underwater. She looked down. Garrett Tull's eyes were open. Not fully, they were at half-mast, unfocused, struggling awareness of someone who had unconscious, someone who had been unconscious and was now fighting back toward the surface. Every return to consciousness was costing him something. But they were open, and they were moving, and they found her face with the slow precision of a man whose body was working again, and whose mind was beginning to try. He looked at her for a long moment. She watched his face move through several things she couldn't quite name: confusion, recognition, confusion again, and then something that was either pain or something older than pain, something that had been waiting a long time to surface. His voice gave out. He tried again. You're not? Don't talk, she said. You're in a hospital. You're going to be okay. Just breathe. His hand moved a weak, incomplete motion toward her wrist, not quite reaching. I know you, he said. The words came out, broken at the edges, roughed up by whatever the blast had done to his airways, but the certainty in them was absolute. I know you're... He coughed, and it cost him, and his saturation dipped to 91 and came back. Paktika, he said. You were in Paktika. The room was still completely silent. Nora was aware of every person in it. She was aware of Vance behind her, and the residents, and the camera at the room's edge that had been rolling this entire time. She was aware of all of it with the peripheral precision of someone who'd operated in environments where knowing where everyone was could be the difference between a situation and a catastrophe. She looked at Garrett Tull's face. You need to stay still, she said quietly. I'll explain later. Right now, I need you to breathe steadily and let us work. Something moved through his expression, not acceptance exactly, more like a man deciding to trust a decision that had already saved his life once. His hand stopped reaching. His eyes stayed on her face for another few seconds, and then they drifted closed, not unconscious, just exhausted in the way of people who have burned everything they had just staying alive. Nora straightened. She turned around. Doctor. Roland Vance was standing 4 feet behind her, and she had been right about the stillness. He hadn't moved, and his face had the particular quality of a man who was working very hard to recalibrate in real time. Behind him, his residents had the looks of people who had just watched something they didn't have a category for. Sasha Holt was at the far edge of the bay, and her expression was different from everyone else's, not shocked, exactly. So, more like something that had been a question for her was no longer a question. The camera was still on. Nobody had told it to stop. He needs a chest tube, Nora said. Right side, standard placement. He'll also need a CT of the chest and abdomen once he's stable. The blast mechanism means we can't rule out additional injury. His tympanic damage means we need audiology consult. But that's not tonight's problem. Tonight's problem is getting that tube in and getting him to imaging. She said it to the room, not to Vance specifically. Because it was information the room needed, and the room was what she was responsible for. Vance said nothing for 3 full seconds. Then, get the thoracostomy tray. His voice was flat, stripped of its usual resonance. A man running on autopilot because the part of him that usually drove had temporarily lost its way. One of the residents moved. Nora stepped back from the bedside and removed her gloves and did not look at Vance and did not say anything further, because there was nothing further to say. She had said the thing that needed saying. The patient was breathing. The rest of it, all of it, was going to happen. All of it was going to happen whether she said anything more or not, and she had learned a long time ago that the moment after you've done the necessary thing is not the moment to speak. She stood at the edge of the bay and watched Vance work. He placed the chest tube with the technical proficiency that she had never actually doubted he possessed. Hands steady, approach correct, the procedural competence of someone who had placed hundreds of these and could do it in his sleep. What he couldn't do, she had discovered tonight, was stop being certain long enough to look at what was in front of him. Those were 2 different problems. Only one of them had nearly killed a man. The blood and air drained. Garrett Tull's pressure climbed to 92/60 and held. His saturation settled at 97% and stayed there. His chest rose and fell with the even, reliable rhythm of someone who had come back from the edge of something and was now resting on solid ground. The immediate crisis was over, which was when Nora understood that the next crisis was already beginning. She knew it before she left the bay. She knew it the way she'd always known when a situation had passed through one phase and entered another, not a premonition. Nothing dramatic, just the cold, clear reading of a room, and the people in it. Vance had not looked at her again after she turned around. His residents had taken their cues from him, which meant the deliberate avoidance was already spreading. Patricia Lund had appeared at the bay door during the chest tube placement, had taken in the scene with the practiced eye of a charge nurse who understood institutional dynamics, and her expression had been the expression of someone calculating something. Nora completed her documentation at the nurse's station with the same precision she applied to everything. She wrote down what she had observed, what she had communicated to the attending physician, what his response had been, what she had then done, and why, citing the specific clinical indicators that had informed her decision. She used objective language. She cited the patient's vital signs with timestamps. She noted the outcome. She saved it. She sent a copy to the charge station record. Then she went back to her other patients, because she still had 40 minutes left on her shift and 3 other people who needed her. And the situation she had just walked out of was going to move forward at its own speed, regardless of what else she did tonight. At 2:14 in the morning, Patricia Lund found her in the hallway outside Bay 4. "Administration is going to want to speak with you tomorrow morning," Patricia said. Her voice had the particular careful neutrality of someone delivering bad news that they are not personally responsible for. "I expected that," Nora said. "Dr. Vance has filed an incident report." "I expected that, too." Patricia was quiet for a moment, in the way of someone who has more to say and is deciding how much of it to actually say. "What you did in there," she said finally. "The needle decompression. You've done that before." It wasn't quite a question. "Patient was 60 seconds from cardiac arrest," Nora said. "Yes, I've done it before, in a rural hospital setting. In several settings," Nora said, and left it there. Patricia studied her for a moment, really studied her, with the evaluating thoroughness of a woman who had been reading trauma floor staff for 20 years and knew the difference between confidence that came from luck and confidence that came from something older and harder to acquire. Then she nodded once and walked back toward the station. Nora watched her go. She finished her shift. She drove home in the dark, Uchesson, 11 minutes through the empty mountain streets of Masfor, parked in the lot of the apartment building she'd rented, month to month, because she hadn't been sure enough about staying to sign a longer lease. She sat in the truck for a while without getting out. Not because she was upset, because she'd learned a long time ago that transitions between one kind of situation and another, between one phase and the next, deserved a few minutes of just sitting still. She had saved him. Garrett Tull was alive, and his pressure was stable, and in the morning he would probably be awake and confused, and asking questions that nobody on the floor was prepared to answer. She had also, in the process of saving him, made herself visible in a way she had spent 12 years carefully avoiding. The documentary camera had footage of everything. The incident report was already filed. Administration would have questions. Vance would have a version of events that centered his authority and her violation of it. And that version would have institutional momentum behind it, because institutions protect the people who generate revenue and reputation, and Nora Welles generated neither. She knew this. She'd known it the moment she reached for the needle. She'd reached for it anyway. She got out of the truck and went inside. The meeting was scheduled for 9 a.m. She arrived at 8:50, which was when she arrived for everything, not early enough to look nervous, not late enough to look resistant. The administration office was on the 4th floor, away from the clinical areas, with the particular hush of spaces that deal in consequences rather than immediate care. The receptionist directed her to a conference room where 2 people were already seated, Doctor. Miriam Schaffer, the chief medical officer, who Nora had met once at orientation and had the impression of a woman who made careful decisions slowly and stuck to them, and a hospital attorney whose name Nora hadn't been given in advance. Vance was not there. His absence was itself a form of presence. Ms. Welles, Schaffer said, thank you for coming. Please sit. Nora sat. I want to be direct with you, Schaffer said. Dr. Vance has filed a formal incident report citing unauthorized medical intervention and patient endangerment. He has also requested that you be removed from trauma floor assignments pending review. She said it without editorializing, which Nora noted as a point in her favor. A person who had already decided the outcome didn't usually bother being precise about how they described it. I've reviewed the available documentation, including the vital sign records, your nursing notes, and the preliminary incident report. I want to hear your account. My documentation is complete, Nora said. I've read it. I want to hear you say it. So, Nora said it. She described what she'd observed in the bay from the moment the patient arrived. The vital signs, the physical findings, the specific combination of clinical indicators that had pointed unambiguously to tension pneumothorax. She described communicating her assessment to Dr. Vance twice, clearly, with specific clinical reasoning both times. She described his response. She described the monitor reading. At the moment she acted 71% saturation, 58 systolic, and the approximate time window she'd assessed was remaining before irreversible cardiac arrest. She described the procedure she'd performed, the technique she'd used, and the immediate patient response. She said all of it in the same, even, specific language she used for her documentation. No emotion in the delivery, not because she didn't feel anything, but because emotion wasn't what the situation required. When she finished, Schaffer was quiet for a moment. You performed a needle thoracostomy, the attorney said, without physician authorization, on a patient whose care was being actively managed by the attending surgeon. The attending surgeon was preparing to intubate him. Nora said, positive pressure ventilation in a tension, pneumothorax would have been fatal within 60 to 90 seconds. The patient's saturation was 71% and dropping. There was no remaining time for further communication. You don't have privileges to perform that procedure at this facility. No, Nora said. I don't. So you're acknowledging the violation. I'm acknowledging that I performed a life-saving intervention on a patient who had seconds of viable cardiac output remaining and that he is alive this morning as a direct result. She kept her voice even. Whether that constitutes a violation is a question of institutional policy. Whether it was the right decision is a question of medicine. Those are two different questions, and I'm happy to discuss both. The attorney opened his mouth. Schaffer held up one hand, a small gesture, but it stopped him. Schaffer looked at Nora for a long moment with the expression of a woman who was running a calculation she hadn't expected to be running when she'd walked into this room. Where did you learn to perform needle thoracostomy? She asked. Trauma experience, Nora said. Rural hospital trauma experience. Among other settings. There was a pause. What other settings? Schaffer asked. I'd prefer to get to the outcome of this meeting first, Nora said. If there are further questions about my background, I'm willing to answer them in the appropriate context. It was a line she'd prepared, not because she was hiding, not exactly, but because she had learned that the time to reveal something was not always the time when someone else decided they wanted to know it. Timing was its own form of information management, and she had been managing information for a long time. Schaffer studied her. The attorney studied her. The room had a quality of recalibration, the same quality the trauma bay had carried in the minutes after the decompression. Pending the formal review, Schaffer said finally, you are reassigned from trauma floor coverage to the medical surgical unit. Your trauma bay access is suspended. You will continue at your current compensation. The review timeline is 5 to 10 business days. I understand, Nora said. Do you have anything further to add? I'd like a copy of Dr. Vance's incident report. Another pause. That's within your rights, Schaffer said. And I'd note that the documentary crew had a camera operating in the trauma bay for the full duration of last night's incident. Whatever footage they captured is potentially relevant to the factual record. She said it with emphasis, without the particular satisfaction she might have been entitled to feel. Just a fact offered at the appropriate moment. Schaffer's expression shifted a small movement, but Nora caught it. I wasn't aware, Schaffer said quietly, and this time she was clearly talking to the attorney more than to Nora. I thought you might not be, Nora said. She left the conference room at 9:22. She took the elevator to the fourth-floor lobby, and she stood at the window for a moment, looking out over the Crestfall skyline while the city did the morning things cities do: traffic moving, people walking, the ordinary, relentless motion of a world that was not particularly concerned with what had happened in a trauma bay the night before. She was not surprised by the reassignment. She was not shaken by the attorney, or by Vance's incident report, or by any of the machinery that was now in motion around her. She had navigated institutional machinery before in environments considerably less comfortable than a Colorado hospital. What she was thinking about was Garrett Tull. He was in the ICU. Now she'd checked the board before the meeting. His status was listed as stable. He would be waking up if he hadn't already. He would be asking questions. And somewhere in this hospital, or on a phone somewhere, or in a car heading toward Crestfall on a military transport, there were people who knew things about Garrett Tull that the hospital staff didn't know. Things that were going to arrive here, eventually, with the particular force of information that has been compressed and contained and is finally being released. She took the elevator down to the medical surgical floor and reported to her new assignment. She did her job. She was good at it, but she was counting the hours. Garrett Tull woke fully at 11:47. The following morning, she knew the time because Sasha Holt texted it to her, which was itself significant because it meant Sasha had decided something about where her attention lunged on and was acting on it, regardless of what the floor hierarchy suggested. He's awake, asking for the nurse from last night. Nobody up here knows who he means. Nora stared at the message for a moment. Then she typed back, how is he clinically? Stable. Pressure's holding. He's alert and oriented, and apparently pretty insistent about the nurse thing. Nora put her phone in her pocket and went back to the medication cart she'd been working through. Because she was on the medical surgical floor, and she had 8 patients, and Garrett Tull was not technically her patient, and going to the ICU was not technically her assignment. And there was a formal review underway, and every action she took right now was being noted by people with the authority to use it against her. She thought about all of that. Then she thought about Garrett Tull's face when he'd looked at her across the bay, then the way recognition had moved through his features. It's like something breaking through from a long way down. I know you. You were in Paktika. She finished the medication cart. She documented everything. She told the medical surgical charge that she was taking her first break of the shift and went to the elevator and pressed the button for the ICU floor. She found his room at the end of the east corridor, room 14, blinds half drawn, a military liaison officer she didn't recognize, sitting outside the door with the particular posture of someone doing a job that was mostly waiting. He looked up when she approached. Nurse Welles, he said. She stopped. How do you know my name? Commander Tull described you. He stood up. He's been asking for you since he woke up. I was told you were on a different floor. I am. He's pretty persistent. He was persistent in Paktika too, she said, and pushed the door open. Garrett Tull was propped up in the ICU bed at about 30 degrees, which was correct for his chest tube positioning. He had a nasal cannula running oxygen and an IV in each arm, and the particular look of a man who was in significant pain and was managing it through the kind of willful stubbornness that seemed to be a prerequisite for the work he did. His eyes found her the moment she came through the door, and something in his face shifted the release of a tension that had been held for a long time. "I thought I imagined you," he said. His voice was rough, but stronger than it had been in the bay. "You didn't," she said. She came to the chair beside the bed and sat in it, because standing over him felt wrong, given the history. "You saved my life," he said. "I've done it before." He looked at her for a long moment. "I know. I spent 11 years trying to find out what happened to you." The words sat in the room. Nora looked at her hands, both of them, right and left, the left one with its slight tremor that had been with her since Germany. She didn't say anything immediately, because the thing he'd just said was large enough to deserve a moment before she responded to it. "They told me you didn't make it," Garrett said. His voice had changed, stripped of the professional register, down to something much older. "The extraction report. They listed you," as he stopped. "I read that report 11 times. The record was wrong," she said. "I survived the surgery. There was a documentation error during the medevac handoff, and it took almost 3 months to correct. And by the time it was corrected, I'd been separated from service, and the corrected record went into a file that didn't connect to the original." She said it evenly, because she'd had 12 years to make peace with it, or something that functioned like peace. "By then I was in civilian life. Why didn't you?" He started and stopped again. "Why didn't you try to reach anyone? Let people know you were?" "I tried," she said, "for about 8 months. The record system didn't connect correctly. My discharge paperwork went through a different channel than my medical records. It was a bureaucratic problem that nobody had incentive to fix because officially I was already accounted for." She paused. "And I was dealing with other things." Her left hand. The 3 surgeries. The 18 months of rehabilitation that had given her back function, but not everything, and had taken from her the career she'd spent 14 years building in the Air Force, and had deposited her into civilian life with a partial record and a body that worked differently than it used to, and a skill set that didn't translate cleanly into anything with a title people recognized. She'd become a nurse. She'd been good at it. She'd gotten quiet and gotten good and stayed that way. "I owe you my life," Garrett said. "You don't owe me anything." "That's not how it works, Garrett." She used his name for the first time, and he registered it. She could see him register it. The slight shift in his expression. "You were a casualty in a situation I was trained to handle. I did my job. That's all. You carried me 40 yards. 41, she said, and a small involuntary thing happened at the corner of her mouth that might have been a smile in different circumstances. I counted. He looked at her with an expression she couldn't fully categorize, not gratitude exactly, though that was part of it. Something some more like the look of a man who had been carrying a weight for a very long time, and had just been told he could put it down, and wasn't quite sure yet how to stand without it. "Why are you on a different floor?" he asked. The liaison said, "You were transferred." "Bureaucratic problem," she said. "I'm dealing with it." His jaw tightened. "Because of what you did last night. It'll resolve. Tell me what's happening." "You focus on your recovery," Nora said. "That's what you need to be doing right now. I'm a SEAL commander. I don't do recovery, I do information." His voice had taken on the practiced authority of a man accustomed to situations where knowing everything was the first step toward managing them. "Someone filed a report against you. It's being reviewed. For saving my life. For performing a procedure outside my authorized scope," she said. "The clinical outcome isn't the issue. The institutional process is." He stared at her. "That's insane. That's hospitals. I want to speak to whoever filed that report." "Garrett." She kept her voice, even in quiet. "Right now, the most useful thing you can do is let the process run and not make it more complicated. I have been navigating institutional processes since before you finished Bud SS. I know how to do this." He looked at her for a long time. The monitor beside him ran its quiet rhythm. Somewhere down the hall, a door closed. 11 years, he said finally. "I've been thinking about that night for 11 years. And he stopped. You've been here? You've been doing this. Being invisible. I'm good at it, she said. I noticed. Something moved through his expression. The surgeon who almost killed me. What's his name? She didn't answer. Nora. It was the first time he'd used her name. She felt the weight of it, not romantic. Nothing like that. Just the particular weight of a name spoken by someone who knew what it was worth. She stood up from the chair. I need to get back to my floor, she said. I'll come back when I can. Wait. He reached for her arm carefully, across the IV lines, not grabbing, just contact. They're not going to fire you. I won't let that happen. You're a patient in an ICU, she said gently. Your jurisdiction is limited right now. It won't be for long. She looked at his hand on her arm. She looked at his face. There was something she recognized in his expression, not Garrett Tull specifically, but a type she had known before. The particular stubbornness of people who had been through things that should have broken them and had come out the other side with their will, not just intact, but somehow stronger. And sometimes that was a problem, and sometimes it was exactly what a situation needed. She didn't know yet which one this was going to be. Rest, she said. That's an order. She went back to the door. She had her hand on it when he spoke again, quiet enough that she almost missed it. There's someone else who knew about you, he said. About what you did. He's been trying to find the right file for 3 years. She stopped. His name is Colonel Artis Bowen, Garrett said. He's my commanding officer's superior. He's been quietly running a records review for classified field operations from that period, looking for documentation errors. Nora kept her hand on the door. He found something, Garrett said. About 2 weeks ago. I didn't know what it was. I didn't know it was about you. A pause. He was already on his way here before last night. Before all of this, she turned around slowly. Garrett Tull was watching her with the expression of a man who has delivered information he knows is going to change the shape of a room. He lands in Crestfall in 4 hours, he said. 4 hours. Nora stood with her hand still on the door and ran the number through everything it meant. Psychologically, professionally. 4 hours was not enough time to prepare for something she didn't understand yet, and she didn't understand yet what Colonel Artis Bowen had found, what the records review had turned up, or why a senior military officer had been en route to Crestfall before any of last night had happened. The coincidence was too precise to be coincidence, which meant it was something else convergence. Maybe the kind that happens when multiple threads of the sling finally reach the same mate at the same time, without anyone having planned it that way. She looked at Garrett Tull. He was watching her with the steady attention of a man who had given her a significant piece of information and was now waiting to see what she did with it, which was also what he would do in a tactical situation, and she recognized the behavior for what it was. What did he find? She asked. He didn't tell me specifically. He said it was a records correction matter involving a classified field operation from the Paktika period, and that it required in-person handling. Garrett's voice was careful. I didn't connect it to you until you walked into this room. Did he know you were here, in this hospital? He knew I was being transported after the training incident. He would have been notified of my receiving facility within the first few hours. A pause. So yes, he knew. Nora thought about that. Bowen had been heading to Crestfall before Garrett arrived. He'd been heading here on a records matter, and now Garrett was in a hospital in Crestfall, and she was the nurse who had kept him alive, and her own records, the incomplete, error-riddled, bureaucratically buried documentation of 14 years of Air Force service, were sitting in a file somewhere that a colonel had apparently been trying to correctly assemble for 3 years. She didn't know whether to feel something about that or what to feel if she did. Rest, she said again, and left. She took the stairs back down to the medical surgical floor because she needed the 4 minutes that the stairs gave her, needed the physical motion and the isolation of the stairwell and the sound of her own footsteps to run through what she knew and what she didn't know and what she needed to do in the time available. What she knew, the formal review of her conduct was in progress. Vance had filed against her. Administration had suspended her trauma access. The documentary footage existed, and she had flagged its existence to the CMO, which had created a variable that nobody had fully accounted for yet. And now a colonel from the military was landing in 4 hours with a file that apparently concerned her directly. What she didn't know, what was in the file, whether it helped her or complicated things further, whether Bowen's arrival would intersect with the hospital's review process or run parallel to it, whether Vance knew any of this was coming, and if not, when he would find out, and what he would do with the information when he did. What she needed to do, her job, exactly her job. Nothing more and nothing less, documented with the same precision she'd been applying since day one, because the most important thing she could be when Bowen arrived and the review concluded and whatever happened next happened was someone whose conduct was completely, verifiably beyond question. She pushed through the stairwell door onto the medical surgical floor and went back to her patients. She heard about Vance's press interview at 2:15 in the afternoon from an orderly who'd seen it on someone's phone in the break room. The documentary production company had released a clip not from last night, but from earlier in the week, a segment that had apparently been in their editing pipeline already. It was a 3-minute piece centered on Vance, discussing the challenges of leading a trauma department, the importance of clear command hierarchy in emergency medicine, and the part that had apparently made its way onto 3 local news sites within 90 minutes of posting his perspective on the dangers of well-intentioned clinical overreach by non-physician staff. He hadn't named her. He didn't need to. The clip had been posted at 1:47 p.m. The hospital's formal review was still ongoing. Her suspension from trauma was still in effect. And now there was a 3-minute video on the internet that any reasonable person watching it would understand was about the nurse who'd performed an unauthorized procedure on a Navy SEAL commander the night before. Framed by the surgeon she'd contradicted as a cautionary tale about knowing your lane. Nora watched the clip once on her phone in the supply room. Door closed, 30 seconds of her break time. She watched it with the specific quality of attention she reserved for situations that were going to require a response not reactive, not emotional, just cataloging. Vance's phrasing, the framing of the segment, the production company's decision to post it during an active review process. She noted all of it. Then she put her phone away and went back to her patient in room 6, who was a 63-year-old man with a post-operative infection and a genuine terror of needles that he hadn't mentioned to anyone until Nora had noticed the way he braced every time she came into the room and had asked him directly. "It's not the pain," he told her. "It's the I don't know, the going in part. Do you want to look away or do you want to watch?" she asked. Some people do better watching. Helps their brain understand what's actually happening versus what it's imagining. He thought about it seriously. Watch, maybe. She walked him through it not cheerfully, not with the performative gentleness that sometimes reads as condescending, but practically with genuine specifics where the needle was going, what it was doing, how long the sensation would last. He watched. His hand gripped the bed rail hard enough that his knuckles whitened, but he watched, and he breathed, and when it was done, he let out a long, unsteady exhale and said, "That wasn't as bad as I made it." "It never quite is," she said. "But it's not nothing either. You did fine." She documented and moved to the next room, and then the next, and she was in the middle of an assessment on a 48-year-old woman with poorly controlled blood pressure when her phone buzzed with a text from a number she didn't have saved. "This is Sasha Holt. Not on a floor line. There's something happening upstairs that you need to know about." Nora stepped into the hallway and typed back, "What floor?" "Trauma admin corridor. Vance called an emergency department meeting 40 minutes ago. I don't know everything that was said, but two of the other attendings walked out of it. And one of them looked, I don't know. Angry doesn't cover it. What was the meeting about? A pause. Then he's proposing to make the incident report a formal department position. Not just his complaint, the whole department's. Nora read the message twice. If Vance converted the incident report from a personal complaint to a formal departmental position, it would change the weight of the review significantly. It would no longer be one surgeon's grievance against a nurse. It would be a department's collective assertion that her intervention had violated safe practice standards, which would carry more institutional force and would be harder to push back against with individual documentation, however thorough. It was a smart move. She had underestimated his speed. She typed, which attendings walked out. Dr. Ferris and Dr. Okafor. And Nora, I need to tell you something. I've been pulling the documentary footage. Not all of it. The producer gave me access to the raw clip from last night, the unedited version. I've watched it 4 times. Nora was very still in the hallway. What's on it, she typed. Everything. The whole bay. Clear audio. Your warnings. Both of them. With timestamps. His response. The monitor readings. The intervention. The outcome. Another pause, slightly longer. And something else. Before the patient was brought in, there's about 90 seconds of footage of Vance in the Bay Prep area talking to one of the production staff. He didn't know the sound was still recording. What did he say? The pause this time was long enough that Nora had counted to 11 before the response came through. He said, and I'm reading directly, if anything goes wrong tonight, make sure the framing puts us in the team. I'm not carrying a military casualty on my record in an election year for the board seat. Nora read it. She read it again. The board seat. There was a hospital board election. In 3 months, she'd seen the notice in the employee newsletter without paying it particular attention. A surgeon on the board would have significant influence over department structure, hiring, and she thought about this, specifically the terms of documentary partnerships and the revenue they generated. Vance had known a military casualty was inbound before the patient arrived. He'd had 90 seconds to think about how it would affect his image, and what he decided to think about in those 90 seconds was the board seat. She thought about Garrett Tull's saturation at 71%. She thought about Vance's hands moving toward the laryngoscope. She typed, preserve that footage. All of it. Don't send it to anyone yet. Where is the producer now? Still in the building. He's been in a meeting with Hospital Legal for the last hour. I think they're trying to get the footage. Which side is he on? Another pause. I genuinely don't know. He gave me access voluntarily, but that was before legal got involved. Nora put her phone in her pocket and finished her shift with the particular focused calm of someone who has a great deal going on beneath the surface and has decided that nothing going on beneath the surface is useful to anyone if it shows on their face. At 4:48, she clocked out. At 4:51, walking through the parking structure toward her truck, she heard footsteps behind her and turned around. It was Patricia Lund. Patricia was in her coat, badge still on, the look of a woman who had made a decision and was uncomfortable with it and was doing it anyway. That combination of discomfort and action was, in Nora's experience, where the most reliable behavior lived. I saw the clip, Patricia said, the one he released. I saw it too, so. I also pulled the Callaway documentation from last week. Patricia stopped a few feet away. Parking structure had the echoey quality of concrete spaces, and their voices bounced slightly in a way that made everything sound more exposed than it was. Your timestamps. His response. The interval between your warning and the crash. She paused. That's the second time. Yes, Nora said. He's trying to make this a department position. You probably know that, I heard. Ferris and Okafor walked, Patricia said. And I want you to know I've been doing this job for 22 years. I've worked under 6 different trauma chiefs, and I have never... She stopped herself. compressed whatever she'd been about to say into something smaller and harder. Ferris is going to speak to Schaffer tomorrow morning. He wants the documentary footage included in the review. Okafor is considering whether to file a counter-report. Nora looked at her. Why are you telling me this? Patricia held her gaze for a moment. Because I told you on your first day that Dr. Vance has expectations and that everyone says they'll meet them. A brief pause. You met something. I'm not sure it was his expectations. But it was something. She walked back toward the hospital entrance without waiting for a response. Nora watched her go. Then she got in her truck and drove to the airport. She didn't go inside. She parked in the short-term lot and waited because she didn't know what Bowen looked like, and she didn't have his contact information. And the only thing she knew for certain was that Garrett had said 4 hours, and 4 hours was now almost up. And if this man had spent 3 years on a records review that connected to her, she wanted to see what he did when he arrived, before he knew she was watching. It was a field habit, old and probably unnecessary, and she did it anyway. He came through the arrival's door at 6:03, a compact man in his mid-50s in civilian clothes, moving with the particular ground-eating efficiency of someone whose body had been trained to cover distance without wasting it. He had a carry-on, no checked bag, the travel profile of someone accustomed to going places quickly and not planning to stay long. He looked at his phone, then at the taxi line, and then he looked up, and his eyes swept the parking lot with the automatic habit of someone who always checks the perimeter. She got out of the truck. He saw her immediately. His eyes stopped on her, and he went through a rapid assessment. She could see it happening, the involuntary cataloging, and then something in his face changed. Not dramatically, just a small but clear recognition, not of her face specifically, but of something about her that matched something he was carrying. He crossed the drop-off lane toward her. Nurse Welles, he said. Not a question, Colonel Bowen. He stopped 3 feet from her, looked at her with the thoroughness of someone who had been building a picture of a person from documents for a long time and was now checking it against the real thing. She let him do it. She'd done the same thing with people before. Garrett called you, he said. He mentioned you were coming. He wasn't supposed to do that. He was also supposed to be dead in a trauma bay last night, she said. He's not great with instructions. Something moved across Bowen's face, not quite a smile, but the place where a smile would be if the situation called for one. No, he said. He never has been. He looked at her for another moment. Then, I have a file. You need to see it before I take it into that hospital. And I need to understand what's happening in there before I decide how to proceed. Then we should talk, she said. Yes, he said. We should. She drove. He sat in the passenger seat with the carry-on between his feet and a manila folder on his knee that he didn't open immediately, and she took the long route to the hospital, not because she was stalling, but because the conversation that was coming needed something more than a parking lot, and a moving car was the right context for things that required a certain kind of privacy. The records review, she said. How did it start? Garrett. Bowen was looking at the road ahead rather than at her. He filed a formal inquiry 3 years ago. Casualty records from the Paktika recovery operation, November of the relevant year. He'd been trying to find information about a specific Air Force pararescue operator who was listed as a fatality in the extraction report, but whose service file didn't match the circumstances of the reported death. A pause. The discrepancy had been sitting there for 12 years. Nobody had looked at it, because nobody had reason to, until he started asking. And the records review found what? She said. Several things. He opened the folder on his knee. In the passing streetlights, she caught glimpses of documents-dense text, some military formatting she recognized, a page that appeared to be a service record. The primary finding is a documentation error originating at the medevac handoff point. Your casualty status was entered incorrectly during a mass casualty processing event. There were 9 casualties from that operation, 2 of whom were KIA, And there was a data entry error during triage documentation that transposed identifying information between you and one of the fatalities. I know that part, she said. I spent 8 months trying to get it corrected. The correction was entered, Bowen said, incompletely. It corrected the casualty status in one database, but not in the secondary records system that connected to your service file, which is why your discharge paperwork processed as a medical separation without the full service history attached, because the system that generated your discharge documentation was still pulling from the uncorrected record. She drove. A traffic light went red, and she stopped at it and sat in the red light's color and thought about 8 months of phone calls and letters and forms submitted to offices that sent her to other offices, all of it going nowhere because the error existed in a layer she couldn't access. The second finding, Bowen said, and his voice had changed slightly lower, more deliberate, is that your service record, when correctly and completely assembled, includes a recommendation for the Air Force Cross that was filed by the senior officer on the Paktika recovery operation and was processed into the same corrupted file path. It was never formally presented. The recommendation was valid. The award was approved. It simply never reached me, she said. Never reached you. The light went green. She drove. The Air Force Cross. Second highest military decoration the Air Force issued. She had known about the recommendation vaguely, the way you know about something that was mentioned once in a context where you were too focused on surviving to pay it full attention. She had not known it had been approved. She had assumed it had been lost, along with everything else. Why did it take 3 years? She asked. Military records from classified operations run through a separate declassification review before they can be used to correct a civilian record. The Paktika operation had a classification tier that required sign-off from 2 levels of command before the relevant portions could be released. Bowen paused. Sign-off came through 6 weeks ago. I've had the complete file for 18 days. And you were coming here to find you, he said simply. To give you what you're owed and correct what was wrong. That was the plan before any of this happened. He gestured vaguely at the hospital, visible now as they rounded the final turn toward the complex. What I found when I landed is that you're in the middle of something. Yes. Tell me what, so she told him. She told him about the first week, the Callaway incident, Vance's pattern, the documentary. She told him about Garrett's arrival, the tension, pneumothorax, the decompression, the immediate aftermath. She told him about the incident report, the reassignment, the administration meeting, the clip Vance had released. She told him about Sasha's text and the pre-bay footage, and what Vance had said in those 90 seconds when he hadn't known the sound was still recording. She told him all of it with the same objective precision she used for clinical documentation, because objective precision was how you made information useful. When she finished, Bowen was quiet for several seconds. He released a media clip during an active internal review. Bowen said, "Yes," without naming you. He didn't need to. And the documentary crew has footage that contradicts his incident report. Yes, and potentially footage that implicates him in a separate ethical problem. Another silence. The board seat, Bowen said. That's what the footage suggests he was thinking about. Bowen sat with that for a moment. Then he said, I need to make 2 phone calls before I go into that building. Will you give me 10 minutes? She pulled into the parking structure and stopped the truck. Take what you need, she said. She got out and leaned against the truck's side panel and looked at the hospital's lit windows while he made his calls in the passenger seat with the door closed. She could hear the low murmur of his voice, but not the words. She didn't try to hear them. She watched a nurse exit through the ground floor side door and light a cigarette and stand in the cold with the particular exhausted stillness of someone mid-shift who needed 3 minutes to be outside. She thought about 14 years. Not with grief, exactly. More with the specific feeling of looking at a map of a route you'd traveled, and seeing, from the elevation of the current position, how many of the turnings had been determined by a single error made by a tired clerk in a field processing unit during a mass casualty event in November. How much of what she'd become in the 12 years since had been built around an absence, the missing record incomplete file, the wound that had healed wrong because it had never been properly cleaned. The passenger door opened. Bowen got out. "I've spoken to the hospital's chief of staff's office and to a colleague at JAG," he said. "Here's what's going to happen." She turned to look at him. "I'm going into that hospital in a formal capacity. The military has a direct interest in the clinical care received by an active duty special operations commander, and I have the authority to request access to all documentation related to Commander Tull's treatment and the events surrounding his admission." He said it with the flat efficiency of someone who had thought through the steps and was now executing them. That includes the incident report, the internal review documentation, and as part of understanding the full clinical picture, whatever documentary footage exists of the Trauma Bay events. "The production company has legal involved," Nora said. "The production company filmed inside a military patient's treatment space," Bowen said. "That creates an access question that their legal team is going to find inconvenient to argue." She looked at him. "You can do that?" "The authority exists," he said. "Whether it ultimately holds up to challenge is a different question, but by the time anyone mounts a serious challenge, the footage will have been reviewed and its contents will be part of the formal record." A pause. "I'm going to go in there and I'm going to do this correctly, and I need you to let me do it without trying to run it yourself." "I'm not trying to run anything. You've been running everything since day one," he said, not unkindly. "I've spent 3 years reading the record of a woman who found a way to function in every environment she was put in, including ones that were designed to make her invisible. I know what I'm dealing with." He looked at her steadily. "Let me do my part." Something in her chest moved, which surprised her, because she'd spent a long time being very good at keeping her chest still. "All right," she said. They walked in together through the main entrance, and the front desk staff looked at Bowen's credentials and made a phone call, and then made another phone call, and within 7 minutes they were being escorted toward the administrative wing by someone who had the look of a person who had not expected their Tuesday evening to go this direction. They were halfway down the corridor when a door opened ahead of them, and Dr. Roland Vance walked out. He saw Bowen first, took in the credentials, the folder, the military bearing. His expression ran through several things in quick succession: assessment, calculation, the beginning of whatever performance he'd decided to mount for this audience. Then he saw Nora beside him. The performance stopped. She watched something move across his face that she didn't have a clinical name for, but recognized from other contexts. The expression of a man who had been very certain about the dimensions of a problem and had just discovered the problem was larger than the container he'd built for it. "Dr. Vance," Bowen said. His voice was completely even. "I'm Colonel Arts Bowen. I'm here regarding Commander Garrett Tull's admission and the events surrounding his care. I'd appreciate 10 minutes of your time and access to your department's incident documentation from last night." Vance looked at Nora one more time. She didn't say anything. She didn't need to. "Of course," Vance said, and his voice was almost right, almost had the usual resonance and confidence. Almost, but not quite. Bowen followed the escort into the administrative suite. Nora stood in the corridor. She was not invited into the meeting she hadn't expected to be, and it was correct that she wasn't, because this was not her part of it. She understood how to stay outside a room that was working on her behalf, and how to let it work without inserting herself into it. She found a chair near the window at the end of the corridor and sat in it and waited. At 7:23, Sasha Holt came around the corner with 2 cups of coffee, one of which she held out without comment. Nora took it. They sat together without talking for a while, which was the right kind of company for this kind of waiting. Outside the window, Crestfall ran its nighttime version lights. Traffic. The indifferent momentum of a city that didn't know and mostly wouldn't care that the shape of something was changing on its fourth floor. At 8:09, the administrative suite door opened. Bowen came out. First, then Dr. Miriam Schaffer, who had the look of a woman who had just had a conversation that had significantly reorganized her understanding of a situation. Then two people Nora didn't recognize, one in a suit that read attorney, one in scrubs that read senior clinical staff. Vance did not come out. Schaffer stopped when she saw Nora in the chair. Her expression was complex in a way that didn't resolve immediately into anything simple. "Ms. Welles," she said, "we need to speak." Nora stood up. She set down the coffee cup. "The documentary footage," Schaffer said, "has been secured as part of the formal review. Both the trauma bay recording and the pre-admission recording." A pause. "I want you to know that I am taking both recordings very seriously." "I understand," Nora said. "There will be additional conversations tomorrow. I'd ask you to be available from 8 a.m. Schaffer looked at her steadily. "And I want to say the Callaway documentation. The timestamps. I reviewed it again this afternoon. I know. I should have looked at it more carefully the first time. It was not quite an apology." It was the closest thing Nora had heard from anyone in institutional authority to an honest acknowledgement that something had not gone the way it should have, and she accepted it at its exact value, which was considerable. "Thank you for telling me," she said. Schaffer nodded and moved toward the elevator with her assembled group. Bowen remained. He waited until the corridor was clear. "The footage is in the record," he said. "All of it. The pre-bay recording is going to be a problem for him." He said it simply, without satisfaction. "There's also the Callaway documentation you flagged, and the two attendings who walked out of his meeting today have both agreed to provide statements." Nora processed all of it, and the department position he was trying to build. "Ferris already sent Schaffer a formal Belgefett before I arrived." It didn't get far. Bowen paused. "The board seat election is in 90 days. The hospital's legal team is now very aware of the pre-bay recording and what it contains. I expect the documentary production company is going to have a difficult conversation about editorial decisions in the next 48 hours. She looked at him. "What happens to him? That depends on Schaffer and the board. But a surgeon on record saying his priority in a military casualty event was his board seat positioning doesn't generally survive a formal ethics review." Another pause. "He will have lawyers. It won't be instant." "No," she said. "It never is. There's something else." He reached into the folder that had been under his arm since the meeting ended and produced a single sheet, not the dense records documents she'd glimpsed earlier, but something cleaner, with a specific type of formatting she recognized. "A citation. This is yours," he said. "It has been yours for 12 years. I'm sorry it took this long to reach you." She took the page. She read it. Her name, the date, the operation, the specific language of a citation that described, in the formal measured prose of military commendation, what she had done on a November night in the Paktika province, the personnel recovered, the conditions, the injuries she'd sustained in the process. The recommendation language, the approval authority, Air Force Cross. The words on the page were exactly what she'd known they would be, and she was still not fully prepared for them. "There's a formal presentation process," Bowen said. "Typically a ceremony. We can discuss the details and timing at your preference. There's no rush now," the record is corrected. He paused. "But I want you to have that copy tonight." She folded the page carefully along its original crease and held it. "Commander Tull would like to be present," Bowen said. "For the presentation, when it happens." He was very clear about that. She nodded, because her voice was doing something she didn't want it to do in a hospital corridor in front of a colonel she'd met 2 hours ago. Bowen gave her a moment. "Then there's a room scheduled with the CMO tomorrow morning, 8 a.m. Your trauma access reinstatement will be on the agenda." "I'll be there," she said. He nodded. He walked toward the elevator. She stood in the corridor alone, holding the folded citation, the fluorescent lights running their indifferent hum above her. Down the hall, behind a closed door, Roland Vance was sitting with whatever was left of the structure he'd built, the cameras, the board seat, the 30 years of certainty, all of it now running through a process he had not anticipated and could not control. She didn't feel triumphant about that. She felt tired, in the specific bone-level way of someone who has been carrying weight for a long time and has just been told they can set some of it down, and is discovering that setting it down is not as simple as stopping. She was walking toward the elevator when her phone buzzed. "Sasha, there's something happening in the ICU. Room 14. You should come." Nora's pace changed. She hit the stairs. She pushed through the ICU door and moved fast down the east corridor toward room 14. And when she was still 10 feet away, she could see through the observation window that the room had more people in it than it should 2 nurses, a physician she didn't recognize, and Garrett Tull sitting up in bed with his arms crossed, and the expression of a man who has decided something and is not going to be talked out of it. She pushed open the door. "What's happening?" she said. The physician she didn't recognize turned around. He had the look of the on-call intensivist, harried, slightly too young for the authority his badge gave him. "Your patient pulled his arterial line," he said. "He's not my patient," she said, and looked at Garrett. "I need to talk to you," Garrett said. His voice was steady, despite everything the monitors said he shouldn't have energy for. "Now, tonight, before whatever is happening tomorrow happens. You pulled your arterial line. I'll let them put it back when you've heard what I need to say." She looked at the nurses. They both had the expression of people who had tried everything reasonable and had run out of reasonable options. She looked at the intensivist. He spread his hands in a gesture that said, "Be my guest," with significant feeling. She walked to the chair beside the bed. "Talk," she said. "I lied to you," Garrett said. "Not about Bowen. About what he found." She went very still. "I said I didn't know what was in the file." His jaw was tight. "I knew part of it. I've known for about 10 days. He held her gaze with the directness of someone who had decided that honesty was going to cost him something and had decided to pay it anyway. The records review found something else. Something that wasn't in the Paktika files. "What?" she said. "Your complete service history," said. When they assembled the full record, there were discrepancies that went beyond the casualty documentation error. Your 14 years of Air Force service, Nora, the full record shows 7 classified operations across 3 theaters. Combat trauma interventions in conditions that most physicians with full privileges have never come close to. "I know what I did," she said. "I know you do." He looked at her steadily. "But the hospital doesn't. Vance doesn't. Schaffer doesn't. The review board doesn't. They've been judging a nurse from an 18-bed rural hospital." He paused. "And they had no idea they were actually looking at someone operational trauma operation with more operational trauma experience than most of the physicians in this building." The room was quiet, except for the monitors. "Bowen has the full record," Garrett continued. "He showed it to me this morning before he went into the administrative meeting. And there's one more thing in it, Nora. One thing that changes what tomorrow's meeting looks like completely." She looked at him. "Tell me," she said. He reached to the bedside table carefully, favoring his right side, and picked up a printed page that had been folded in thirds. He held it out to her. She took it. She unfolded it. She read it, and the color left her face for the second time in as many days, because what was printed on that page was something she had not known existed, had not known had been filed, had not known, had been sitting in a classified record for 12 years, told someone to select the right place at the right time, with the right authorization. It was a medical licensure equivalency assessment, filed by the Air Force's medical authority during her active service, documenting that her training, operational experience, and demonstrated clinical competency across 14 years of Air Force pararescue combat medicine, met or exceeded the standards required for advanced practice licensure in emergency and trauma medicine. A document that, if entered into the formal review record, did not simply explain why she had known how to perform the decompression. It raised a question that nobody in that hospital had thought to ask yet. Question about what, exactly, Nurse Nora Welles was actually licensed to do. She read the document a second time, slowly, because the first read had moved too fast through the language, and she needed to be certain she was understanding what it said and not what she wanted it to say. The Air Force's medical authority had filed a clinical competency assessment during her final active duty year standard procedure for long-service pararescue personnel, apparently a documentation process she'd been aware of, in the way you're aware of administrative processes that happen around you without requiring your direct participation. What she had not known was the specific language the assessing physician had used. What she had not known was that the document had been classified into the same file cluster as the Paktika operation records, and that it had sat there for 12 years as inaccessible as everything else in that cluster, and that what it said in the formal measured language of military medical assessment was that her clinical competency in emergency and trauma medicine had been evaluated against advanced practice licensure standards and found not merely adequate, but exceeding them in multiple categories, including needle and tube thoracostomy, surgical airway management, hemorrhage control, and emergency vascular intervention. She folded the page back along its crease. She looked at Garrett. "Who else has seen this?" she said. "Bowen, me, as of tonight." He was watching her with the careful attention of a man who understood he'd just handed someone a significant piece of leverage and was waiting to see how she carried it. "He showed it to me this morning because he wanted my assessment of whether it was relevant to what was happening here. And you said, I said it was the most relevant thing in the entire file." His voice was flat, in the way of someone who has stopped being diplomatic, because the situation is past the point where diplomacy is the most useful tool. "Nora, they filed that incident report against you for performing a procedure you weren't authorized to perform. This document raises the question of whether you were actually authorized, just not through the channel they knew to look for." "It's not that simple," she said. "Military medical authority and state licensure are different systems. This assessment doesn't automatically confer civilian privileges. No, but it's evidence of a documented competency standard that a licensing board can review." And more immediately, he paused. "It's evidence that when you performed that decompression, you were not an untrained nurse making a reckless decision. You were a credentialed practitioner operating within her documented scope in a system that didn't have her complete records." The monitors ran their quiet rhythm. Down the hall, a call light chimed and was answered. She thought about Vance's incident report, the language it would use: unauthorized intervention, endangerment, scope violation, the institutional weight of a surgeon's formal complaint against a floor nurse. The way that weight distributed itself through a review process that had no context for what she actually was, because nobody in the building had her actual file. Until now. "Let them put the line back in," she said. "And sleep. I need you functional tomorrow, not heroic." She handed the document back to him. He took it. "You're going to be okay," he said. It wasn't a question. "I'm going to be fine," she said, which was not quite the same thing, and they both knew it. She left his room and told the intensivist he'd cooperate now, and she walked back down the corridor and took the elevator to the lobby and sat in the least observed corner of it for 11 minutes because she needed 11 minutes to think without anyone looking at her. She ran through what she had, the documentary footage secured, the pre-bay recording in the review record, the Callaway documentation time-stamped and specific. 2 attending physicians who had walked out of Vance's meeting and were providing statements, in essence. Bowen and his military authority now formally engaged with the hospital's administrative process. And the competency assessment not a legal instrument on its own, but a document that changed the factual framing of what had happened in that bay. She ran through what was still uncertain, how Schaffer would weigh all of it. Whether Vance's attorneys would move to suppress the pre-bay recording, on some grounds she hadn't anticipated. Whether the board seat politics would exert pressure on the review outcome that outweighed the clinical and ethical evidence. Whether the licensure question would open a door or just create another layer of procedural complication. She was not naive about institutions. She had worked inside them long enough to understand that evidence and outcome were not the same variable, that the weight of a correct argument could be outpaced by the weight of an inconvenient one if the people holding the scales had reasons of their own. But she had more now than she'd had 48 hours ago. She got up and went home. She was at the hospital at 7:45. She'd slept 4 hours, which was less than she needed and more than she'd expected. She'd made coffee in the apartment that still had the temporary quality of a place she hadn't committed to. Yet she hadn't hung anything on the walls, had stacked most of her books against the bedroom wall rather than on the shelf, because the shelf arrangement felt like a statement she wasn't ready to make. And she'd dressed in her hair and pinned her hair back and done the specific thing she always did before situations that required her to be at her most precise. She'd sat at the kitchen table for 5 minutes doing nothing at all. Just sitting, letting everything settle. Then she'd driven to the hospital. Bowen was in the lobby when she arrived. He had changed clothes and slept somewhere, and he had the focused quality of a man who had made his plan and was executing it, which she found more useful right now than reassurance would have been. The production company's legal team contacted the hospital at 6 a.m., he said, without preamble. They're not fighting the footage access. They're cooperating. She took that in. Why? Because their lawyer watched the pre-bay recording last night and apparently spent 45 minutes on the phone with the network's standards and practices division afterward. He paused. A documentary about a celebrated trauma surgeon who said what Vance said on camera in a space where their crew was filming is a liability problem they are not interested in carrying. They're going to use it, she said, eventually. But right now, they're more interested in not being on the wrong side of a military casualty incident than they are in protecting their subject. He looked at her. The footage is in the record, all of it. Schaffer's team reviewed it last night after we spoke. The 8 o'clock meeting was in the same fourth-floor conference room as the first one. This time, the assembled group was larger. Schaffer, the hospital attorney, a woman Nora didn't recognize who was introduced as the chair of the Clinical Ethics Committee, and Bowen, who had been granted a seat at the table in his formal capacity. Vance was not present. His attorney had submitted written materials in advance, which sat in a folder in front of the hospital's attorney, and the attorney had the look of someone who had read those materials and found them less useful than had probably been hoped. Nora sat. Schaffer opened without ceremony. I want to be direct about where we are. The review has produced a significant amount of information, some of which substantially changes the picture from the initial incident report. I want to go through it, and I want your input where relevant. All right, Nora said. What followed was 90 minutes of the most thorough institutional conversation she had ever sat through, and she had sat through investigations in settings considerably less comfortable than this. Schaffer went through it methodically, the Callaway incident documentation, and what it showed about the pattern of clinical observation and dismissal. The trauma bay recording and the specific timeline it established, Nora's warnings, Vance's responses, the monitor readings, the intervention, the immediate outcome, the pre-bay recording, and what Vance had said in it. The statements from Ferris and Okafor, the competency assessment document, which Bowen had formally submitted as part of the military's interest in the complete clinical record of care provided to Commander Tull. The Ethics Committee chair asked Most of the questions directed at Nora, and they were specific and clinical. Walk me through the assessment findings at the moment you made the decision to intervene. What was your estimated time window? What was your confidence level in the diagnosis? What was your familiarity with the procedure? Nora answered all of it in the same way she answered clinical questions at a bedside directly, specifically without decoration. At the 90-minute mark, Schaffer called a 10-minute recess. Nora went to the hallway. Bowen came with her. The attorney is going to push on the licensure question, Bowen said, keeping his voice low. He'll argue that the competency assessment is a military document with no standing in a civilian licensing framework, and that whatever Vance said before the patient arrived doesn't change the procedural violation. He's not wrong that those are two separate questions, Nora said. No. But Schaffer's framing the board seat comment as an ethics matter rather than a licensure matter, which means it gets evaluated differently. He paused. She's going to separate the two issues. Vance's conduct on one track, your conduct on another. The licensure goes to the state board for a formal review that takes months. But the ethics question moves on the hospital's own timeline. She thought about that. What does she have authority to do right now on her own timeline? Quite a bit, Bowen said. When the meeting resumed, Schaffer laid it out with the specific clarity of a woman who had made her decisions and was now implementing them. The formal review of Nora's clinical conduct would continue as required by hospital policy, but effective immediately, her suspension from trauma floor access was lifted pending the outcome of that review on the grounds that the evidence before the committee indicated a clear clinical justification for the intervention, and that the safety case for reinstating her access outweighed the institutional case for continued suspension. The competency assessment had been forwarded to the state licensing board with a formal hospital request for expedited review. The incident report filed by Dr. Vance would be assessed in the context of the complete documentary record, including the footage and the Callaway documentation pattern. And Dr. Roland Vance was placed on immediate administrative leave pending a separate ethics investigation into the pre-Bay recording and its contents. Schaffer said all of it in the same even, deliberate voice, and when she finished, she looked at Nora across the table. I want to say something that is not part of the formal record, Schaffer said. Ms. Welles, the Callaway documentation, the pattern it represents. Had I looked at it more carefully after the initial incident, some portion of what followed might have gone differently. She held Nora's gaze with the steadiness of someone who decided that the honest version of this was the only one worth delivering. I should have looked more carefully. I didn't. That's mine to carry. Nora received it. I appreciate you saying so. It wasn't absolution for either of them. It wasn't meant to be. The news of Vance's administrative leave moved through the hospital with the speed that's significant. Institutional news always moves fast, slightly distorted at the edges, different in each retelling. By noon, the version circulating among the trauma floor nursing staff was mostly accurate. By 2 p.m., two of Vance's residents had separately requested meetings with the department's interim chief to discuss their training situation. By 3, the documentary production company had issued a statement that their editorial team was conducting a thorough review of all footage from the Hargrove Peak project before any further content was released. Nora was back on the trauma floor, not triumphantly. She'd walked in at 11:15, nodded to the charge nurse who was covering in Patricia's absence. Patricia had a scheduled day off that she had apparently declined to cancel on the grounds that she had been scheduled for it. And that was that, and taken her assignment and done her job. 3 patients through the afternoon. An elderly woman with a hip fracture and a sharp, specific wit that she deployed like a tool when she was anxious. A 23-year-old who'd been in a motorcycle accident and whose main preoccupation was whether his bike was salvageable. A middle-aged man who asked her 4 times whether his doctor had seen his latest labs. and who she finally sat with long enough to understand that what he was actually asking was whether anyone was paying attention. She paid attention, she documented. She moved through the floor with the same quiet efficiency that had always characterized her work here, except that now when she moved through a space, people's eyes followed her differently. Not all of them, and not in any way that required acknowledgement. But the floor had a different quality than it had had 24 hours ago, and she was aware of it the way she was aware of most things, fully and without comment. Sasha found her at the medication station at 4. Ferris is going to take the interim chief role, Sasha said. She was keeping her voice at the register of a clinical conversation, which was wise. He's already talking about restructuring the trauma training program. Good. 2 of the first-year residents asked if they could be reassigned for the remainder of the rotation. She paused, away from Vance's previous structure. Also good. Sasha was quiet for a moment. I went back and looked at his last 18 months of cases, she said. Ferris gave me access to the aggregate outcome data. There's a pattern in the near-miss events. She said it carefully. The way you say something you've been turning over for hours and have finally decided to say out loud. 3 of them have documentation that looks similar to Callaway. Attending dismissal of early nursing assessment. Delayed recognition. Nora stopped what she was doing and looked at her. Have you written it up? She said. Not yet. I wasn't sure if it was mine's. Write it up, Nora said. Specific, objective, time-stamped where you can get the timestamps. Take it to Ferris first, then Schaffer, if Ferris thinks it warrants escalation. Don't make it about Vance. Make it about the pattern and what it means for the department going forward. That's a significant thing to submit as a third-year resident. Yes, Nora said. It is. Sasha looked at her for a moment. Is that what you would do? It's what I did, Nora said. On a smaller scale. With Callaway. I documented, I escalated through correct channels, and I kept the record clean. She paused. The record is what remains when everything else is being disputed. Make your record clean and specific and you'll have something to stand on. Sasha nodded slowly, the nod of someone absorbing something that was going to take a while to fully settle, but that she already knew was right. She left to start writing. At 6:15, Bowen called her. There's a development, he said. She stepped away from the nurse's station. What kind? Vance's attorney contacted the hospital board this afternoon. They're challenging the administrative leave on procedural grounds, arguing that the pre-bay recording was obtained without appropriate consent notification under the documentary agreement's terms, and that its use in the ethics review therefore constitutes a process violation. She'd anticipated something like this. Not the specific mechanism, but the general shape of it. A man with 30 years of institutional standing and the resources to fund a legal challenge was not going to accept administrative leave without pushing back. What's the board's position? She said. Divided, apparently. 3 members are inclined to let the challenge proceed, which would pause the ethics review while the persecution is resolved. N. 2 others are pushing to keep the review active. A pause. The deciding vote belongs to the board. Who is? And I want you to understand. I am saying this with complete neutrality, a longtime colleague of Vance's who funded the documentary project through a private arts grant 3 years ago. She was quiet for a moment. When does the board vote? She said. Tomorrow morning, 8 a.m. She thought through it. The procedural challenge, if it succeeded, would pause the ethics review. A paused ethics review meant Vance's administrative leave became legally ambiguous. An ambiguous leave situation meant he could, potentially, be back in the building before the review concluded, which would change every variable in the department's current recalibration. Is there anything that changes the calculus before 8A? She said. Possibly, Bowen said. The production company's Standards and Practices Division has been reviewing the footage since last night. If they make a formal determination that the pre-bay content constitutes a material breach of their subject's duty of candor under their production agreement, which is a standard clause in documentary contracts. Then the footage was legally obtained and the consent argument collapses. He paused. I've been informed they're finalizing that determination tonight. When tonight? Before midnight, they said. And if they finalize it after midnight? A brief silence. Then it goes to the board vote before the determination is in, and we're in a different situation. She stood in the hallway and looked at the trauma bay doors at the end of the corridor, the same doors Garrett Tull had come through 2 nights ago, the same doors she'd been standing behind when the overhead speakers had fired, and she'd understood, somewhere below language, that something was about to happen that was going to change the shape of things considerably. She thought about the board chair. The documentary grant. 3 years of Vance performing for cameras he had. Also, apparently, solicited through connections that ran all the way to the top of the hospital's governance structure. There's something else, she said. What's that? The grant documentation. The one the board chair used to fund the documentary. It would be public record if it was filed through the hospital's foundation. A pause. Yes, Bowen said carefully. It would be. And if the board chair had a financial relationship with the production company through that grant, not just as a donor, but in a capacity that created a conflict of interest in any board decision touching the documentary footage, then his vote on the procedural challenge would be compromised, Bowen said. And he would be required to recuse. Yes, she said. Another pause. That would require someone to formally raise the conflict before the vote. It would, she said. Do you have access to the Foundation's grant records? They're public, she said, and I know someone who is very good at finding things in documentation that people assume nobody is going to look for. She ended the call and texted Sasha, "Are you still in the building?" 3 seconds, yes. Writing up the pattern analysis. Can you take a break? I need someone who's good with document searches. 40 seconds this time. Then, what are we looking for? Foundation grant records. Hargrove Peak Foundation, last 3 fiscal years. Documentary production partnerships. Board chair financial disclosures. A longer pause. That's a significant thing to look for. Yes, she typed. It is. She was walking toward the residence library, where Sasha had set up her workstation, when her phone buzzed again. Not Bowen. Not Sasha. A number she didn't recognize, Colorado area code. She answered. Nurse Welles. A man's voice. Measured. The voice of someone who had been doing a job for a long time and was not accustomed to being on the back foot. Yes, she said. My name is Gerald Pruitt. I'm on the Hargrove Peak Board of Directors. A brief pause. I understand you've been through a significant 2 days. She said nothing. She let the silence sit, which was its own form of response. I'd like to meet with you this evening, Pruitt said, informally, to discuss the review process and some of the context around it. The review process has appropriate channels, she said. It does. I'm suggesting something outside of those channels. Another pause. There are aspects of this situation that I think both of us would benefit from discussing before tomorrow morning's board session. She understood immediately what this was. Not a threat, he was too careful for that, and too experienced to put anything threatening into a phone call. But a negotiation. An informal conversation that would, if she participated in it, carry implicit pressure toward an outcome that served his interests, which were, this moment, identical to Vance's interests. I appreciate the call, she said. I'll see you at the board session tomorrow, if there are things you'd like to discuss. A brief silence. Wells, good night. Mr. Pruitt, she said, and ended the call. She stood still for a moment. Then she walked into the residence library where Sasha was already pulling up the hospital foundation's public filings on a monitor, and she sat down beside her, and they started going through the records with the systematic thoroughness of 2 people who understood that the truth was almost always in the documentation, if you knew where the documentation lived. It took 40 minutes. The grant record was in the foundation's fiscal year, filing exactly where public records required it to be. Hargrove Peak Foundation, Documentary Arts Initiative, 3 years prior, a grant of $240,000 to a production company for the purpose of producing a documentary series featuring the hospital's trauma department. The production company's name was familiar. It was the company filming the trauma floor. The board chair's name appeared in the grant authorization signatures. And there, in the conflict of interest disclosure section that foundations were required to complete for grants above a certain threshold, was a single line that had apparently been filed and then not looked at by anyone who understood its significance. Gerald Pruitt, board chair, disclosed a minority financial stake in the production company at the time of the grant authorization. A financial stake in the company whose footage he was now being asked to rule on. Sasha stared at the screen. "That's a recusal," she said. "Yes," Nora said. "That's a mandatory recusal." "Yes. If he votes anyway, then any board decision touching that footage is challengeable," Nora said. "And he knows that. Or he will, the moment this is formally raised before the session." Sasha looked at her. "Who raises it?" "Someone with standing to address the board," Nora said. "Which isn't me, Ferris," Sasha said immediately. "Or Bowen." "Bowen," Nora said. "He has military authority and no hospital politics. It's cleaner." She photographed the relevant pages with her phone and sent them to Bowen with a 2-sentence summary. His response came back in 4 minutes. "Understood. I'll have this in front of the board secretary before 7 a.m." She sat back in the chair. Sasha was looking at her with an expression that had several things in it: exhaustion, something that might have been exhilaration if the situation had been less serious, and a kind of careful consideration. "Can I ask you something?" Sasha said. "Go ahead." "How are you this calm?" Nora thought about it honestly. "I've been in situations where being calm was the difference between a good outcome and a bad one," she said. "Eventually it stops being a choice and starts being a habit." "What kind of situations?" Nora looked at her, the smart, tired, good third-year resident who'd texted her vital information at 2 a.m, who'd found her in the medication room to ask the right question. On day 4, who'd walked into the documentary producer's office on her own initiative and asked for footage access because she'd decided that watching something go wrong without acting was not something she was willing to do. "The kind that prepared me for this one," Nora said. "Write up the pattern analysis. Get it to Ferris tonight." Sasha nodded. She turned back to her monitor. Nora walked back to the floor. At 8:47 p.m., Bowen texted. Production company issued their determination. Pre-bay footage is covered under the production agreement's candor clause. Consent argument is void. She read it twice. At 9:12, a second text also. JAG has reviewed the competency assessment. Their position is that the document is admissible as evidence of demonstrated clinical competency in any proceeding involving the recorded interventions. They'll provide a formal letter by morning. She put her phone in her pocket. The floor was quieter now, nighttime rhythms, lower census, the particular hush of a hospital after visiting hours ended. She walked through her remaining patient checks with the same methodical attention she brought to everything, and she noticed things about each of them. The hip fracture woman had finally fallen asleep, without her call light on, which meant her pain was managed better. The motorcycle patient had a visitor, a young woman sitting in the chair beside his bed, with her hand on his arm. The man who'd wanted someone to pay attention to its labs had eaten his dinner, which was the clearest sign that his anxiety had come down a level. Small things, real things. She was finishing her documentation at 10:45 when Patricia Lund came in through the side entrance, coat on, badge off, the particular expression of a woman who had absolutely not come in on her day off, but who was here regardless. She walked directly to the nurse's station and stood across from Nora. Pruitt called 3 of the nursing union reps this afternoon, Patricia said without preamble. Asked them to submit a statement supporting the procedural challenge. framed it as a patient safety issue, argued that allowing military-obtained documentation to influence a hospital review process set a dangerous precedent for staff privacy. Nora looked at her. Did they submit it? Two of them said they'd consider it. One of them told him she'd need to review the full documentation first. Patricia paused. I've spent the last 4 hours getting them the full documentation. Patricia, I've been on this floor for 22 years, Patricia said. Her voice was not loud, but it had a weight to it that Nora hadn't heard from her before, not the institutional authority of a charge nurse, but something more personal and harder-edged. I watched what happened to Calloway. I watched him dismiss you in front of his cameras, and I charted it in my head, and I didn't do anything with it because he was Roland Vance, and I had a department to run. And she stopped herself. The union reps are not going to submit that statement. Nora held her gaze. Thank you. Don't thank me, Patricia said. I should have seen it earlier. She turned and walked back out the side entrance. Nora sat with that for a moment. Then she finished her documentation, handed off to the night charge, and was putting on her coat at 11:20 when her phone buzzed one final time. Not Bowen, not Sasha, not a number she recognized. A text, no name, Colorado area code, different from Pruitt's. This is Vance. I need you to know that whatever you think you've found, this isn't over. I've built this department for 15 years. You've been here 3 weeks. There are board members and department chairs and legal resources that you have no concept of, and before tomorrow's session concludes, that will make tonight's document searches look very small. She read it. She read it again. She thought about a man who had built 15 years of certainty on never being wrong, who was watching that certainty come apart and had apparently decided that a text message to the nurse who'd started the process was the right response to that. She thought about what he'd said before Garrett Tull's stretcher had come through the doors. I'm not carrying a military casualty on my record in an election year for the board seat. She typed back one sentence. Everything you just said is now documented. She put her phone in her pocket and walked to her truck. She sat in the parking structure for longer than she usually did. Not because she was afraid she wasn't, not of Vance's lawyers or his board, connections or whatever he thought he had left to play, but because the text had told her something she hadn't fully accounted for. He was more desperate than she'd assessed, and desperate people with resources were a specific kind of unpredictable, and she wanted to think carefully about what that meant before 8 a.m. The text was documented. She'd stated so, and she'd meant it. She'd already forwarded it to Bowen with a timestamp before she'd left the building. But the part of it that stayed with her as she drove home through the empty streets of Crestfall at 11:43 at night was not the threat itself. It was the phrase, things on the table, that will make tonight's document searches look very small. He'd used the plural, things, not a procedural argument, not a legal strategy. Things, with the particular weight of a man who believed he was holding something specific. She didn't know what it was, and not knowing, with the board session in 8 hours, and Garrett Tull in ICU bed, and 12 years of buried record about to be formally surfaced, was the worst possible position to be in. She parked, she went inside. She sat at the kitchen table for longer than 5 minutes this time. Whatever Vance was holding, it was going to be on the table in the morning. And she didn't know what it was. She slept 3 hours and woke at 4:40 without an alarm, which was how she'd always woken before things that mattered, not from anxiety, just from the part of her that had spent 14 years calibrating itself to the requirements of the next 24 hours, and had never fully stopped doing it. She made coffee. She sat at the kitchen table. She thought about what Vance could be holding. She'd been turning it since she'd driven home, running it through every angle she could find. He'd said things, plural, and he'd said the document searches would look small by comparison, which meant he believed he had something of greater weight than a conflict of interest disclosure and a production company's candor determination. He'd had his attorneys working since the administrative leave was announced. His connections ran through the board, through the documentary network, through 15 years of department relationships. And then at 5:17 in the morning, sitting in a kitchen with bare walls and books stacked against the baseboards, she understood what it probably was. Her own record, not the complete assembled version that Bowen had built through 3 years of careful review, the incomplete, error-riddled version that had existed in civilian systems for 12 years. The one that listed 6 years of Air Force service in the vaguest possible terms. The one that didn't connect to the classified operation files, or the competency assessment, or the cross-recommendation. The version of her history that, if someone wanted to argue that she was an unqualified rural nurse who had made a reckless and dangerous decision in a trauma bay, supported that argument completely. Vance had attorneys who'd had, since yesterday afternoon, to pull every publicly accessible record attached to her name. And what those records showed, absent the military files that only Bowen could access, was a woman whose documented qualifications did not explain her actions in Bay 1. If he entered that record into the board session and argued that the military documentation Bowen had submitted was classified, unverifiable by civilian standards, and therefore inadmissible as the basis for any hospital review decision, if he could make that argument, before the JAG letter arrived and before the conflict of interest recusal was formally raised, he might be able to reframe the entire morning. She called Bowen at 5:22. He picked up on the second ring, which meant he hadn't been sleeping either. The JAG letter, she said. When exactly does it arrive? They said by morning. I pushed for 7 a.m. Specifically. Can you push for 6? A pause. I can try. What are you thinking? She told him. He was quiet for the length of time it took a careful man to assess a scenario and determine whether it was likely. Then, you might be right. Give me 20 minutes. She used the 20 minutes to dress and drive to the hospital. She was in the parking structure at 5:58 when Bowen called back. 6:45, he said. That's the best they can do. The officer drafting it is in a different time zone, and he's been working through the night on it. That's enough, she said, as long as the board session doesn't open early. It won't. Hospital governance sessions have required quorum and notice. They can't move it up without notification. All right. Nora, he paused. If I'm wrong about the procedural piece, if he has something I haven't anticipated, then we deal with it when it's on the table, she said. That's all you can ever do. She went inside and found a chair near the 4th floor elevator bank and waited. The JAG letter arrived at 6:43. Bowen forwarded it to her phone as he walked off the elevator at 6:51, and she read it in the 2 minutes before the board session's preliminary gathering began. It was 4 paragraphs, formally structured, signed by a JAG officer, with sufficient rank to carry institutional weight. And it stated with the specific unambiguous language of military legal correspondence that the Air Force competency assessment submitted by Colonel Ardis Bowen represented a formally recognized document of clinical credentialing under Air Force medical authority, that its contents were accurate and verified, and that the clinical interventions performed by said individual fell within the scope of documented competency as established by that assessment. 4 paragraphs that said, in the careful language of people who chose their words to serve scrutiny, she had been qualified to do what she did. She folded her phone into her pocket and stood up when the board secretary opened the conference room door. There were 9 people at the table. She recognized Schaffer, the ethics committee chair, 2 faces from the administrative wing, and Gerald Pruitt at the far end board chair, pink-faced, with the particular stillness of a man who was managing something uncomfortable and doing it by projecting calm. Vance was not present. His attorney was a woman in her 50s with the practiced neutrality of someone who had sat in rooms like this many times and had learned to treat them as transactions. Someone sat beside Nora. The session opened, with the board secretary reading the agenda. The procedural challenge was first. Pruitt moved to open the floor to the challenge presentation, and Vance's attorney began speaking in the measured, structured way of someone who had prepared carefully and was confident in the preparation. She argued that the pre-Bay recording had been obtained under a documentary agreement that specified subject notification before material was used in any formal proceeding. She argued that the military documentation submitted by Colonel Bowen, while potentially valid within military frameworks, had not been authenticated through channels that met civilian hospital evidentiary standards. She argued that the administrative leave decision had been made on the basis of material that was procedurally compromised, and that the correct resolution was to suspend the ethics review until proper authentication and consent processes could be completed. It was a thorough argument, well constructed, the kind of argument that worked in rooms where no one had done the prior night's reading. When she finished, Bowen placed a single sheet in front of the board secretary and spoke for 4 minutes. He addressed the consent argument first, the production company's formal candor determination, issued the previous evening, which established that the pre-Bay footage was covered under existing agreement terms. He addressed the authentication argument second, the JAG letter, received 3 minutes ago, which established military verification of the competency assessment through appropriate authority. He did not editorialize. He presented documents and their implications with the economy of someone who understood that in rooms like this, clarity was more persuasive than force. Then he looked at Gerald Pruitt and said, "I'd also like to formally raise a conflict of interest matter before any vote is taken." The room shifted. He laid out the foundation grant documentation in 3 sentences: the production company, the financial stake, the disclosure filing. He did not characterize it beyond the factual record. He didn't need to. Pruitt's face went through several things in rapid succession. His attorney, a different one, present for board, Matters, leaned toward him and murmured something. Pruitt listened, and the calculation running behind his expression was visible to anyone paying attention, which Nora was. "I'll recuse from this vote," Pruitt said. His voice was steady, controlled. The voice of a man cutting a loss before it became a hemorrhage. The remaining board members voted 4-0 to deny the procedural challenge. The ethics review stood. The administrative leave stood. The footage remained in the record. Vance's attorney gathered her materials with the precise contained movements of a professional who had lost a clean argument and was not going to let it show. Nora watched her leave. What Vance had been holding turned out to be exactly what she'd predicted, a compiled summary of her publicly accessible civilian records, submitted through his attorney as supplementary material, with an argument that the hospital's reliance on military documentation over verifiable civilian records created inconsistent evidentiary standards. It was entered into the record. It was also, in light of the JAG letter and the competency assessment, substantially answered before he'd finished making the argument, and the ethics committee chair noted as much in terms that were polite, but left no ambiguity about their weight. He had played his card. It had been the right card given the information available to him. It had simply been answered by a card he hadn't known existed, filed in a classified folder by an Air Force physician 12 years ago, buried by an administrative error, and recovered by a colonel who'd spent 3 years looking in the right places, because a SEAL commander wouldn't stop asking. The formal ethics investigation into Dr. Roland Vance's conduct would take 8 weeks to conclude. Nora knew it wouldn't feel satisfying the way a trial verdict feels satisfying. In a film, there would be no single dramatic moment of public condemnation, no speech, no visible collapse. Institutions moved the way glaciers moved, slowly, with enormous weight, and they reshaped the landscape without announcing it. But the outcome, when it came, was public and specific and carried consequences that were not abstract. Vance's hospital privileges were revoked, pending the conclusion of the ethics investigation. The board seat selection scheduled for 90 days out, was postponed indefinitely given the ongoing proceedings. The documentary production company announced the suspension of the Trauma Floor series, citing the need to conduct an editorial review of all film material before any distribution decisions could be made. Two of Vance's long-term research partnerships submitted formal notices of review, citing the ethics investigation as a triggering condition under their grant agreements. The Calloway family was notified by hospital administration that a retrospective clinical review had identified concerns about the timeliness of care during their family member's admission, and that the hospital was prepared to discuss those concerns directly. Nora was not present for that conversation, but she knew it happened, and that it happened because she had made her record clean and specific from the first day, because the timestamps existed, because she had documented everything with the precision of someone who understood that documentation was sometimes the last form of protection available. He didn't disappear. He hired attorneys who were good at their jobs, and the process was contested at multiple points, and there were weeks where nothing appeared to be moving. But the pre-Bay footage was immovable. The pattern documentation, Sasha submitted thorough, objective, time-stamped, covering 3 cases beyond Calloway, was immovable. And the fact that he had sent a text message to a nurse the night before a board session, laying out in his own words his belief that he had resources she had no concept of, was in the formal record and would remain there. Some things once documented cannot be undoctrinated. The formal presentation of Nora's Air Force Cross took place in the Hargrove Peak Medical Center's main atrium on a Thursday morning, 6 weeks after the board session. It was not a large ceremony. That had been her specific request, and Bowen had honored it a military chaplain, the relevant officers, a small group of hospital staff. Schaffer attended. Patricia Lund attended in her regular work clothes with her badge on, having apparently declined to treat it as a special occasion requiring a change of wardrobe, which Nora found appropriate. Sasha was there, standing slightly to the back with the expression of someone who wasn't sure if she'd been invited or had invited herself and had decided to come regardless. Garrett Tull attended in a wheelchair, not because he couldn't walk, but because his medical team had won the argument about weight-bearing for approximately 4 more days, and he had decided that winning that particular argument was not worth the energy when there were more important ones. He was in civilian clothes, which somehow made him look more formidable than a uniform would have. The particular solidity of a man who carried his authority in his posture rather than his insignia. He had not seen her since the night she'd told him to rest and meant it. She had not gone back to his room after that, not because she was avoiding him. She'd checked his clinical updates through Sasha, who had no conflict of interest in passing information through unofficial channels, but because she understood something about the dynamic between them that she hadn't quite had words for until recently. He was grateful. He was also the kind of man who experienced gratitude as obligation, and she didn't want his sense of what he owed her to drive what happened between them next. Whatever happened between them next needed to be made of something cleaner than debt. When Bowen pinned the medal, she stood straight and looked at the middle distance. Looked at the middle distance the way you learn to look when something is happening that you need to receive without flinching, which is different from receiving it without feeling it. She felt it. She felt it in the left hand that trembled when she was tired, and in the scar along her left hip that ached in cold weather, and in the 3 years of phone calls and forms and dead ends that had followed her out of military. Service like a weather system, she couldn't outpace. She felt it, and she stood straight, and she did not flinch. Bowen said the formal words. They were the right words, she would acknowledge that. But what she heard beneath the official language was the corrected version of a record that had been wrong for 12 years. Not the medal, specifically, the record. The fact that it now said what had actually happened, and that it would continue to say so, and that no administrative error or database discrepancy or overworked clerk at a field processing unit could undo it again. When it was done and people were moving and talking, and Schaffer was saying something official nearby that Nora registered without fully tracking, Garrett wheeled himself to where she was standing. He looked at her for a moment without speaking, which she appreciated. "You look exactly the same," he said finally. "That's unsettling." "You look older," she said. "I got blown up. That'll do it." Something in his face relaxed, not the formal composure of a military officer or the studied patience of a man in a hospital bed, but something more natural and somewhat surprised, as if he hadn't expected to be able to talk to her like this. As if 12 years of her being dead had built a version of her in his head that she was now failing to match in specific ways he found disorienting and good. "I want to ask you something," he said. "Go ahead." "When you walked into that bay, when you saw it was me," he looked at her steadily. "Did it change anything? About the decision you made?" She thought about it, honestly, the way she thought about most things. "No," she said. "I would have reached for that needle for anyone on that table with those vital signs." "I know," he said. "I just needed to hear you say it." She understood that. The distinction mattered to him, that she hadn't saved him because of who he was, that the decision had been made on clinical grounds before recognition had finished processing. It meant the debt was cleaner. It meant what she'd done was simply what she did, and not something extraordinary performed specifically for him. It meant, she suspected, that he could look at her as something other than the person who had saved his life, which opened up the possibility of eventually looking at each other as something more ordinary and probably more interesting. "There's something I want to ask you," she said. "All right." Bowen mentioned a proposal, a joint trauma training program, military and civilian. He said there might be a role for someone with combined operational and civilian clinical experience. Garrett was very still. "He mentioned it to you." "He mentioned it." He was vague about details. "That's because he wanted me to be the one to ask." Something moved in Garrett's expression, a ruffle quality, the look of a man recognizing that he'd been managed by a colonel he respected and wasn't sure whether to be annoyed about it. "The program is real. It's been in planning for 2 years. It needs someone who can bridge the gap between battlefield trauma protocol and civilian emergency medicine, someone who's functioned at a high level in both environments." He paused. "I submitted your name 3 days ago." Bowen co-signed the recommendation. She looked at him. "You submitted my name before asking me. I knew you'd say yes. You didn't know that. I knew you'd think about it for exactly as long as you needed to, and then say yes," he said, "which is different." She stood with that for a moment. She looked around the atrium at Sasha, who was talking to one of the other residents with the animated energy of someone who had recently submitted a pattern analysis that was being taken seriously and had discovered that taking the right risk at the right moment felt different than she'd expected it to feel. At Patricia, who was checking her watch in the way of someone who had given an occasion its appropriate time and was now ready to return to the floor where she was needed. At the trauma bay doors visible down the east corridor, the same doors she'd walked through on the first morning, with a travel mug and a duffel bag, and the particular determination of a woman who had decided that getting smaller was not the same as getting better. She thought about 14 years of carrying other people through situations they couldn't survive on their own. She thought about 12 years of carrying the absence of the record that proved it. She thought about 3 weeks in this hospital and a needle on a crash cart's second shelf, and a man's trachea drifting back toward center, while a room full of people who had never seen that before stood in complete silence. She thought about what it meant to be good at something that nobody knew you could do, and what it might mean to do it somewhere that knew. "Tell Bowen I'll take the meeting," she said. Garrett's expression did the thing she'd seen it do in the ICU room, the release of something held. "I'll tell him." She nodded. She looked at the medal on her chest for a moment, not with reverence, Just acknowledgement. A small, specific piece of metal that stood in for something that had actually happened and that had always happened, regardless of whether the record had said so. Then she looked at the trauma bay doors. She had patients this afternoon. Real ones with real problems, the kind that didn't care about board sessions or ethics reviews or corrected military records, the kind that only cared whether the person coming through the door knew what they were doing and was going to stay present long enough to do it. She had work. She turned toward the corridor. The floor was busy. It usually was by afternoon, the rhythm of it predictable, in the way that complex systems develop predictability. Once you understand their logic, not orderly exactly, but comprehensible, which was a different thing, and in some ways more useful. She moved through it with the efficiency that had always characterized her. The quiet, purposeful motion that made space for itself, without announcing its presence. Room 3 was a 40-year-old woman with a dislocated shoulder who'd been waiting too long and whose patience had understandably expired. Nora spent 8 minutes with her, not managing her, just being honest about the timeline and what to expect and why, which was all the woman had actually wanted, a thing that was true of most people in most situations if you were paying attention. Room 7 was a 12-year-old boy with his father, both of them in the particular stunned state of people for whom a bad afternoon had become a much worse one, very suddenly. And what they needed was not efficiency, but steadiness, a person in the room who wasn't alarmed by what was happening, because alarm is contagious and so is its absence. Room 11 was a man she'd been following for 2 days, whose recovery was going the way it should, slowly and incompletely, and with the ordinary frustrations of a body doing difficult work. And what he needed was someone to tell him honestly that slow and incomplete was the correct trajectory, and that the frustration was expected, and that both of those things being true at the same time was not a contradiction. She moved through all of them with the same attention. Different rooms. Same quality of presence. At 4:15, Sasha appeared in the hallway. "Ferris wants to know if you'd consider a trauma training session for the residents," she said. "Not formal, just an hour. Assessment methodology. How to read a room before the numbers move. When? Whenever you're available." Nora thought about the 12-year-old in room 7 and the woman in room 3 who just wanted honesty, and the man in room 11 who needed to understand that slow was not the same as wrong. She thought about Sasha in the medication room on day 4, asking the right question with the particular directness of someone who had decided that learning was more important than looking like she already knew. She thought about what it would have meant early in her civilian career to have had someone in that medication room with her. "Next Tuesday," she said, 7 a.m., before the census picks up. Sasha nodded. Something in her face that had been careful for weeks had loosened slightly. The way a person's face loosens when they've been holding a question and have finally gotten an answer they can work with. She left. Nora went back to her patients. At 6:47, end of shift, she was documenting at the nurse's station when she became aware of Patricia standing at the edge of the desk. Not intrusively, just present, in the way of someone who has something to say and is deciding how to say it. Nora looked up. "You're on the trauma roster permanently," Patricia said. Schaffer confirmed it this afternoon. Full privileges pending the licensure board review, which Ferris and 2 outside physicians have already submitted letters for. "I know," Nora said. "She told me this morning." "I know you know." Patricia was quiet for a moment. "I wanted to say it anyway." Nora looked at her. "Why?" "Because I told you on your first day that everyone says they'll meet his expectations, and I said it in a way that was meant to suggest you probably wouldn't." She held Nora's gaze with the steadiness of someone finishing something they'd started. "I was wrong about what I was measuring." Nora received that. "You weren't wrong about the expectations," she said. "You were wrong about which ones mattered." Patricia considered that. Then she nodded, once, with the particular economy of a woman who does not waste motion on things she's already understood. She went back to the charge desk. Nora finished her documentation. She closed the chart. She stood and stretched her left shoulder, the one that had given her trouble since the third surgery, the one she'd learned to manage with specific movement rather than avoidance. And she looked at the trauma bay doors one more time before she picked up her bag. 3 weeks ago, she had walked through a side entrance with a travel mug and a duffel bag and the specific hope of someone who has been invisible for a long time and has decided, without being entirely sure it will go well, to stop. She had been assigned to an 18-bed rural hospital in every way that mattered. Small, unremarkable, easy to dismiss. She had also been, in every way that the record now correctly reflected, someone with 14 years operating under conditions that most of the physicians in this building had never encountered and never would. Someone who had carried wounded soldiers through hostile terrain and kept them breathing with improvised equipment and had done it consistently enough that a military physician had looked at her competency record and found it exceeded civilian advanced practice standards. Both things had been true the entire time. The institution had only seen one of them. She did not blame them for it. Exactly. Institutions see what the record shows them, and her record had been broken before she arrived. But she had also learned in this building, in these 3 weeks, through the particular education of being dismissed by someone who should have known better, that the record was not the truth of a person. It was just the document. The truth existed, regardless of whether anyone had written it down correctly. She walked to the elevator. She pressed the button for the lobby. The doors opened, and she stepped in, and in the moment before they closed again, she looked at her left hand, the one with the slight tremor, the one that had been with her since Germany, the one she'd spent 12 years managing around and adapting to, and sometimes, in her worst moments, resenting. It was steady. Not because anything had healed, not because the nerve damage had reversed, or the surgeries had finally fully resolved, but because she wasn't tired the way she'd been tired for 12 years, the specific exhaustion of carrying something that wasn't being acknowledged, of doing work that was real while being seen as something smaller than what she was. She had been seen now, fully, correctly, and it turned out that being seen, after long enough, was its own kind of medicine. The elevator doors closed. She had a meeting with Bowen on Monday. She had a training session with Sasha's residents on Tuesday. She had patients tomorrow, who would need exactly what she knew how to give them and would not care what her record said about her qualifications. Because patients don't read files, they read the person in the room. And what she brought into any room she entered was the accumulated weight of everything she'd survived and learned and decided to keep doing despite. That had always been enough. It had always been whether anyone wrote it down or not. She walked out through the lobby doors and into the Colorado evening, the air carrying the particular cold clarity of altitude, and she didn't look back at the building because there was no reason to. Everything she needed from that place was already in motion. Everything else was forward. There are people in every institution, in every city, in every room that matters, people who have been measured by the wrong instrument and found wanting by standards that were never designed to see them clearly. People who have spent years becoming smaller to survive systems that didn't know what to do with what they actually were. This is for them, not the ones who gave up, the ones who stayed anyway, the ones who kept their records clean and their hands steady and their knowledge intact, who waited, not passively, but with the particular active patience of someone who understood that the right moment was not the same as the first moment, who walked into rooms where nobody expected them and did the necessary thing and let the outcome speak for itself. You are not the record that failed to capture you. You are everything you've done in the rooms where it mattered. And sooner or later, in one form or another, the record gets corrected.